ready, we can start.
Oh, I am ready, ever ready.
Ever ready. Wow.
So,
good morning. Good morning, everyone.
Good morning.
Can you all hear me?
We can hear you.
That's what I figured.
Loud and clear, Jerry.
Mahendra? Mahendra? Mahendra, we can go live anytime now.
We are live in 3, 2, 1. Thank you.
Namaste and good morning from Boston again, second day of the event. And we are very, very honored and delighted to have our Honorable Minister, Dr. Harshvardhan ji, with us. In his busy schedule, he's going to speak to us very shortly. Before that, I just wanted to just introduce our board members of Boston Center of Excellence who are present and other speakers, starting with Dr. Balram Singh. He is the chairman of the board. And then Pramit Makode, he is one of the founding board members. Hanmanti Banerjee, she is also one of the founding members. Dr. Purnima, again, same part of our board. Dr. Dinesh Patel is the co-chair of our advisory board of Boston Center of Excellence. Dr. David Frawley, Vamdevji, Padma Shri is also in our board as an advisor. Dr. Darshan Mehta, part of the board from Harvard Medical School and Boston Center of Excellence. Dr. Timothy McCall, he's a well-known teacher of yoga, and also he has written a book, Yoga for Medicine, which is very popular. Dr. Diana Laurie from University of Montana, she's also part of our advisory board. I don't see anybody else. If I missed anyone, sorry about that. So with that, I will hand it over to Mr. Pramit Makode. He is one of the founding members of our board, and please take over from here. He's the host for this morning's event.
Sure.
Thank you. Namaste.
Thank you, Kanchana. Good morning, good evening, and namaste to all of you. I am Pramit Makode. Pramit means friend of all. I am co-founder director of the Boston Center of Excellence. In last 6 years, I have worked extensively in India-US corridor on large-scale healthcare and education-based initiatives in public-private partnership mode. It is my pleasure to host the first session of final day of this conference. In this session, we have keynote speech by one of the most eminent personality of the healthcare ecosystem, Dr. Harshvardhan ji. Namaste, Dr. Sir, who is the Union Minister for Health and Family Welfare and Union Minister Science and Technology and Earth Sciences. He is also elected chairman of the Executive Board of the World Health Organization. Sir, many thanks to you for sparing your valuable time in spite of your busy schedule. It is a proud moment for Boston Center of Excellence and for me personally to welcome and introduce Dr. Harshvardhan ji. Although Dr. Saab, he needs no introduction, but I would like to read a brief profile of Dr. Harshvardhan ji for all of you. 1.5 years into his second term as the health minister of the largest democracy of the world, Dr. Harshvardhan continues to craft bold plans for his country's future. Not only is he initiating radical reforms in healthcare in his second stint at the health ministry, but also continues to hold forth at the Ministry of Science and Technology and Earth Sciences, where he dreams of making India as the innovation capital of the world. A dynamic, high-integrity politician with a scientific temper, yet a high emotional intelligence. He is best described as a visionary who remains excited about empowering India. Rated as amongst the most influential ministers of the ruling political party BJP, Dr. Vardhan is a popular leader, having won consecutive 7 elections with thumping margins. An ENT surgeon by profession, he dreams of delivering universal healthcare for all in a country of over 1.35 billion people. His vision is global as he pushes India to integrate with the digital world. He is also mastermind of India's national digital health blueprint that will catapult India as the global leader in digital health. Early in his public life, he initiated a mass campaign of wiping out polio from face of India, which eventually led to India becoming polio-free in 2014. He has penned his involvement with the journey of the Pulse Polio program in book titled A Tale of Two Drops. And I'm fortunate enough to have a signed copy of Dr. Saab of this book, a very wonderful book, and it was a pleasure reading that, sir. Dr. Vardhan was also elected chairman of the Executive Board of the prestigious United Nations body, the World Health Organization, in May this year. His backing for WHO Essential Drug Program has revolutionized government's attitudes toward public health care. Under his leadership, India and world has managed and handled the COVID-19 pandemic in a very effective manner. I would like to reiterate in my introduction of this great man that Dr. Vardhan is now admired, sir, the world over for the manner in which you handled the entire COVID pandemic crisis in India. With 1.35 billion people, the world thought India would have the highest mortality rate, but we all will be surprised that India has clocked one of the lowest mortality rates in the world as far as the COVID is concerned. The mortality rate has been lower than 1.5%. Sir, with this, I would like to once again welcome you and invite you for this keynote address and to enlighten us. Thank you, sir.
Good morning, good afternoon, and good evening to all my friends and colleagues who are with me right now in this webinar. I've been told that people from all across the world have joined this program, and I know it's morning there where you are conducting this program. It's evening here in India, and it's afternoon at many places. First of all, my greetings to all of you. Dr. Balram Singh ji, Chairman of the Boston Center of Excellence, Mr. Kanchan Banerjee, Mr. Pramit McCall ji, who just now was kind enough to introduce me, and Dr. Timothy, the chairman for this session, and also Dr. Diana Luri. I know that there are so many board members, all are very distinguished people with great reputation and great contribution for the society. I wish I could name all of you, but I am very happy to be part of this. I know the Consul General of India, Mr. Randhir Jaiswal, has also joined this function, and I am particularly pleased to be with all of you. You are all co-founders of this great institution, Boston Center of Excellence. I fondly remember with a lot of nostalgia our meeting that we had in this conference room itself. I think probably it was just before the COVID outbreak in the world. And there were some very high quality discussions that we all had together. And the very fact that you are more particularly working for the field of healthcare, which is I would say one of my passion areas in my life. So that gives me all the more greater pleasure in being part of this function. And I'm so happy that this function is, this particular session is being chaired by Dr. Timothy, who is again a person from my own professional field, and he has been author of several books, and again on a subject which is very, very close to my heart, yoga as medicine. And I was so thrilled to read that his book on the yogic prescription for health and healing, which I have been advocating all my life, apart from being a physician, surgeon with a modern medicine degree. And then, of course, his being also the co-editor of the first medical textbook on yoga therapy. That's also very exciting information, the principles and practice of yoga as in healthcare. I am particularly glad to have Sir David Frawley at this webinar with me. We all know about the various books that he has written on topics spanning Vedas, Hinduism, Ayurveda, and Vedic astrology. And I also remember 2015 when probably he was honored with Padma Bhusan in India. He richly deserved that. And this is a function where I know that there are so many eminent scholars from various parts of America and other countries, and more particularly from Harvard, and experts, scientists, researchers, and there are very good quality participants from all over the world. So it's a great privilege for me to be part of this function, this session, and this meeting, which is around the human development and future of societies. Well, first of all, let me express my heartfelt gratitude to all of you, because it is something which is very, very close to my heart. And talking about it at the fag end of 2020, where I have already been a participant in this journey against COVID and the battle against COVID, because for me this is the 11th month of this journey. It was in the first week of 2020 that there was this information from China delivered to WHO and through WHO to the whole world about the arrival of a new coronavirus causing cases of pneumonia in China. And in this ministry itself, in the present building, we were probably the first ones to respond in the whole world in an organized and institutionalized manner by holding a meeting of the group of experts within less than 48 hours of this news arriving on the international scene on 6th of January. We hosted that first meeting on 8th of January. And at that time, we never knew that 2020 is going to be a hugely sad year for humanity. We have only read, we haven't experienced that. All my life as a health activist, I have experienced so many things. I have been fortunate to have been blessed by God to dream about a polio-free India and to work around this for almost 2 decades continuously at various levels as health minister, as advisor in WHO, and working in the field. But never ever had we, in the rarest of thoughts, had this feeling that one day we'll experience an year when from the beginning of the year to the fag end of the year, we'll be focusing around just one disease, which has in fact caused morbidity all across the globe, affected millions and millions of people, and millions of people have lost their lives. And it's so sad for me as a medical professional also that we have lost huge number of corona warriors, our doctors, our nurses, our paramedics, our frontline workers, our journalists, and so many people in India. We lost many of these frontline workers like policemen, the paramilitary people, the people who have been involved in the fight against COVID, a number of places all across the country. And of course, this is not something around India only. It has happened all across the world. So my initial salutation shall be for those great corona warriors. My greatest heartfelt tributes from the deepest core of my heart for these corona warriors who led from the front. They are still fighting the war against COVID. They are still dedicating their life, and many of them have even lost their life just for saving us. And I would also use this occasion to pay my heartfelt tributes to to the mothers of these corona warriors and the frontline corona warriors who, in spite of the fact that they have seen the misery and the tragedy around the life of these corona warriors, but still, at least I know about India, I could not find even one single mother in India who told his son or daughter who was a corona warrior and working for last 10 months that please stop going to the hospital, please stop going to places where you have these COVID-19 affected patients. So that's I think, something extraordinary. That's something which has the blessing of God, and no words in my vocabulary can really describe the contribution of these corona warriors. Whatever we say for them, I think that is not enough at all. And on behalf of all of you also, I pay my greatest tributes to them. You know that I am myself, as you described, an ENT surgeon. I went to a medical school in the 70s, and it's almost 4.5 decades of dedicated and continuous, consistent involvement with the medical field. And the health as such has been a passion area for me. It's been very close to my heart and soul. All my life, I have worked for the field of health in various positions, whether it was as health minister in the capital of India, or whether it was as a WHO advisor for almost a decade, or whether it was as a union health minister that you can see me right now, or as an activist in the medical associations. But I have always believed that health is probably the most important thing that one should be aspiring for, and one should be aiming for, and one should be preaching for, one should be dedicating for. Because if health and character are lost, we feel that everything is lost. And for a long time, the World Health Organization has been dreaming about a situation where we can really deliver the health for all model for the whole world. And they had initially promised that health for all by 2000, but it could not happen. But in India, I have always believed that India has the potential, India has the DNA, India has the ancient medical wisdom, India has the ability, India has the experience, and India has got almost everything that is required ultimately to successfully deliver a model for health for all, which can be emulated by the whole world. It's only a question of putting things together. And on a number of occasions, we have seen that when India decides, it does it. It delivers that. When we started our polio eradication movement, 20 years back, 25 years back, we were home to 60% of the polio cases of the whole world. And many countries in our Southeast Asia region, and even people in Africa, were not taking up the polio eradication movement because people felt that as long as there are 60% cases in India, there is no point working on it, because you have to ultimately have a global polio eradication movement successful. But when India decided, India did it, in spite of the fact that we are a population of 1.35 billion people. So, as I said, this health has been an area of passion for me. But I was fortunately blessed in 2014, after having spent a couple of months in the health ministry, and I always consider it as the greatest blessing in disguise of my life, of having been given the responsibility of Ministry of Science and Technology and Earth Sciences by my dear Honorable Prime Minister Shri Narendra Modi ji in 2014. And last 6 years, after having worked in the field of science and technology, having seen science from the closest of quarters, having visited every science laboratory inside India, belonging to all spheres, and having seen scientists work with utmost dedication and meticulous precision in their laboratories on almost every subject, I am thoroughly convinced that science has the potential to actually resolve and solve and alleviate the sufferings of every common man around any issue that we can think of, and it has the huge potential to actually deliver to the humanity huge dividends which can change their lives. So this is what, in fact, I also experienced during the last 10 to 11 months, a practical, you see, manifestation of this confidence that I have developed. And I always tell the scientific community also, apart from the medical professionals, that you have to focus on your scientific social responsibility. And I always, in my own way, say that impact factor, its definition should not be about how many times a paper is read by somebody, but it has to be how many people and or how many problems of mankind which the people had been suffering from many decades have been solved by science through your research and through the development of newer technologies by the scientific community. And I have seen that the scientific community has huge potential and ability, acumen, and everything that is required to actually deliver that. Coming back to that 8th of January, just to give you a brief view of what we could do during the last 10 years, which ultimately resulted in today we having a recovery rate of around 94% now, where we can proudly say that out of the 90 lakh odd cases that we had of COVID-19 in India, 85 lakh people have already been cured. They have returned back home perfectly cured, and less than 5 lakh active cases in the country. It's almost around 4.3 lakhs or so. These cases are on a faster road to recovery. We have, as mentioned by Dr. Balram Singh, we have the, or maybe by Mr. Pramit, that we have the least mortality rate in the world. It's right now, today evening at 6 o'clock, it was 1.46. We have already tested over 13 crore people in this country. We are testing 1 million people every day, and there is this huge, you see, statistics around multiple issues, which I may, if I get a chance or time, I can talk about it. But going back to that 8th January in 2020, when we had our first meeting of experts, within the next less than 10 days, on 17th January, we had delivered to the whole country a set of detailed advisories about how, if we also start having these new COVID-19 cases in the country, how are we going to handle it and how are we going to start our fight against it. Our first case had arrived on 30th of January. It was the day when WHO had, in fact, declared this as an emergency of international concern for the first time officially. But on 17th January, we had started the whole exercise of these detailed advisories. We had started our point of entry surveillance at our airports, at our ship ports, and as soon as we got a first case in Nepal, we had started the surveillance on the land borders. We had started the community surveillance, and in all these fields, at any particular moment, we were a few lakh people were always under our detailed and meticulous community surveillance all over the country. We screened lakhs of passengers at our borders. And then, of course, when we got our first case, immediately the Prime Minister constituted a group of ministers under the Health Minister, and I had the privilege to chair a meeting of the group of ministers for almost on more than 20 occasions in the last 10 months. The Prime Minister was monitoring everything all the time. The Cabinet Secretary was monitoring things. We were having video conferences with the health ministers. We were having video conferences with the health secretaries. And even at the national level, I was having video conferences with even the district magistrates of the country at the remotest places in the country. And that this whole exercise, I think, started right from the beginning. And then came the day on 11th of March when it was declared a pandemic. But this is just to apprise you that how early we started our activities around the fight against COVID under the able guidance and inspiration of our Prime Minister Shri Narendra Modi ji. And then you will also recall that towards the beginning of the last week of March, we had that great national lockdown. But just before the lockdown, probably the greatest and the most innovative idea of voluntary participation by every Indian, a Janta curfew on 22nd of March, where every Indian participated in that Janta curfew. It was not an official lockdown, it was only a voluntary lockdown enforced by the people of India on the call of the Prime Minister. And at the same time, 5 o'clock on 22nd of March, everybody in India was felicitating the Corona warriors in the most symbolic manner, coming out of their homes and doing it. And then we saw this lockdown in India, which according to 5 studies, including by some Boston group also, by these different groups, the scientific studies have established that lakhs of cases did not happen because of that lockdown. We could save many people from dying, huge numbers, just because of this lockdown. And then the lockdown, of course, resulted in a lot of problems for the Indians, and of course it has happened all across the world. People facing distress around economic issues around the livelihoods of migrant laborers and fooding and shelter and all those problems. But India, with the help of the vision of the Prime Minister, with his visionary schemes, with his schemes announced with total financial and other support to the poor people, and with the commitment which was shown by thousands of non-government organizations and social organizations in India, we were able to overcome all these difficulties that people encountered. And almost 800 million people were given food and money in their bank accounts for almost continuously for 6 months. And the migrant laborers faced the issue. Over 65 lakh of them were transported and sent to their native places in their villages. And when all this distress was happening, there came a time when there was a need to take a bold decision, as bold as the decision to lock. I think the country under Prime Minister took another bold decision of unlocking, and series of unlocking phases started, and ultimately we could see that in spite of a lot of these difficulties, there was the support given to the people to start their businesses, to start their industry, to start their factories, to start their businesses. But of course, all through, we stressed upon one point. And because as a minister, as a doctor, and you can all appreciate that fighting COVID doesn't involve a lot of rocket science. It is just about ensuring that people follow COVID appropriate behavior, wearing a mask, maintaining a physical distance, concentrating around respiratory etiquettes, hand hygiene, and avoiding crowded places. So from the day one, we had that innovative caller tune in our telephones, message given continuously to 117 crore subscribers in this country. All possible modes of communication used to convince people that they have to follow the COVID appropriate behavior. And at that stage, early in the fight against COVID, I had mentioned to the people of India that this particular activity around masks and social distancing, and added to that at that time the lockdown, they are the real social vaccines for us. And that social vaccine is relevant even after 10 months. Though we are in the process of developing a vaccine, our indigenous vaccines also, though we are in the process of completing our third phase trials in the next 1 or 2 months, and shall be in a position to at least immunize 20 to 25 crore Indians by July 2021. But that is, you see, in spite of that, throughout we have been emphasizing on this social vaccine. The whole country, you must have heard that in the initial stages, we were faced with a lot of issues regarding shortages of PPEs, the N95 masks, the ventilators, the beds, and all those related issues. But within a span of a couple of weeks, by hand-holding our people in India, we reached to a stage where we could manufacture over a 5 lakh number of PPEs in the country. We could start manufacturing ventilators in the country. We could start manufacturing N95 masks in the country. And we were exporting drugs to 150 countries of the whole world. And the testing kits that we were, in fact, importing earlier in the initial stages, we came to a position where we were manufacturing over 1 million kits every day in the country. We validated over 1,000 kits, new kits that were developed in India. And the greatest thing that has happened is the fact that we were blamed in the initial stages for doing only a few thousand tests at few places in the country, because we started our journey with one lab. That was our prestigious National Institute of Virology in Pune. But today, when I talk to you, we have almost over 2,100 laboratories in the country. You just cover a distance of 3 kilometers, even in the remotest of the remote areas, whether it is a mountainous area or it's a tribal area, you will come across a lab established during the period of these lockdowns and other difficult phases. In the most difficult terrains, we have been able to establish labs where we are testing, as I said, over 1 million people, from 1 to 1.5 million people every day. We have repurposed our CBNAT and TrueNAT machines, which were earlier used for tuberculosis diagnosis. We have got the new antigen tests. We have our scientists who have worked out a new Feluda test, is a paper test, which is going to revolutionize and maybe as powerful as the RT-PCR test. So this is about the journey in which, in fact, the total government approach, total society approach, everybody, every ministry, everybody became a party to all this activity. All state governments were on board. Everybody was working on the same wavelength. Prime Minister was having continuous meetings with the chief ministers and with his officers. And within a span of a few weeks, all over the country, we established dedicated COVID hospitals, COVID care centers, COVID health facilities, where there were some 20 lakh dedicated beds and almost over 12,000 quarantine centers, a very active and dynamic strategy of testing, tracking, treating. And our principle was to ensure that we are able to track people. Contacts of the contact tracings are done in the most dynamic fashion. The first case that came to India on 30th of January in Kerala, a medical student who had come from Wuhan, China, we had 162 contacts of that case traced, right from the passengers who traveled with him, around him, sat around him in the flight from Wuhan to Calcutta. So all these 10 months have been a fight against COVID, in which there has been participation from everyone in India. And as I said, the fact that I said that science has the potential to help solve every problem, our scientific community, our laboratory people, they had done an exemplary job. They rose to the occasion, and whatever they were doing earlier in whatever field, everybody was contributing to COVID, whether it was research around vaccine development, whether it was repurposing of drugs, whether it was working on the discovery of new drugs around the fight against COVID, or whether it was developing the biorepositories, whether it was around genome sequencing. By now, we have done genome sequencing of over 4,000 viruses. We have over 15 biorepositories with over 40 to 50,000 viruses stored there, samples stored there for research by scholars and university people. And there is so much that the scientific community has done. The most, you see, scientifically backed PPE kits and N95 masks, BiPAPs, ventilators, with a lot of latest technology. All these have been contributed by the scientific community. So it has been a great, I would say, the only sadness around the fact is that we have lost a few people also. Of course, when we say 1.46%, it may be technically the lowest, but I know as a doctor, I feel as a doctor, as a human being, that even if there is one life lost in one family, for the family, it's 100% loss. It's not just that 1.46% for which we should be happy. And that's what I think we are ultimately further aiming to get our mortality rates less than 1%. See that as soon as possible, we are able to handle COVID. And then finally, I have to say that the COVID has ultimately brought some good news for us. And maybe if whatever we can we have learned during this COVID period, or whatever was forced upon us to change our behaviors, it has certainly reminded us that we used to have clean rivers, we used to have clean air, we used to have clean water, and a lot of those things have got restored. And in the last 6 years, I had been Environment Minister for 2 years, and I could appreciate very much the role of humanity to fight issues around global warming, climate change. I had launched the Green Good Deeds campaign in that ministry, where we had continuously motivated people for adopting green good behavior. The way we are able to, you see, this facility was available earlier also, but COVID reminded us that we can use technology to connect with the whole world. There was no need for traveling from one place to other. COVID has reminded us that we can strengthen our educational component. Sitting at home, we can work from homes. We can ensure that the traffic congestion on the roads contributing to pollution can be avoided by just working. And it has also reminded us that we need to have that strong filial bond of, great relationship within the family. That bond has, I think, once again, it has been reminded to the society while we stayed at home with our grandparents, with our children, and spent quality time with them. So all those issues around human values, they have all been reminded by this. And the fact that we have to respect Mother Nature, we have to respect Mother Earth, all these things have come back in our foresight right now for us to follow. And this is a great time when the new normal that we have seen, developing during the COVID times, if we can just adopt many of these good things together. We in India promoted good nutrition during COVID. We strengthened our Eat Right India campaign. We strengthened our Fit India campaign. We strengthened our movement around yoga, which was reminded to the whole world in 2014 by the Prime Minister through the United Nations. And again, the ancient medical wisdom around Ayurveda, which has been also been a passionate subject for me. When I started my public life 26 years back as Health Minister in Delhi, I had established the Delhi Center for Modernized, Delhi Research Center for Modernized Promotion of Ayurveda, so that we can put it across to the whole world in scientific language with scientific means. And in these 10 months, we have done enough of good quality research around Ayurvedic medications, and the results of those research have shown to us that people who took these Ayurvedic prescriptions during COVID times had, fantastic results. They got better cure. They had less symptoms, and their recovery rates were faster and much better, and there was literally no mortality. So all these things around holistic approach to medicine, the world is now very clearly thinking about integrating modern medicine with other indigenous medicines and things like Ayurveda, yoga, and all those related issues. This COVID has, in fact, given us all these, reminded us about all. And I am very happy that in this session itself, we have speakers who are committed to these causes. And this discussion around the benefit, we may not be able to call it a blessing in disguise, because of course we cannot excuse ourselves for the loss of these lives and the way COVID has troubled the whole humanity. But the time is ripe for all of us to actually assertively acknowledge the teachings of COVID for the modern world. And we need to redefine and reassert and follow now a new path for the future generations to learn and actually rectify the mistakes that we forgot. Our forefathers had told us so many good things, but probably the present generation did not respect many of those things. And that is why probably we are having all these issues like the one that we faced in 2020. So I know I may have taken a lot more time than that may have been assigned for me. I wish I could talk and talk and talk. There are so many thoughts which are coming to my mind, but I would maybe use another occasion to delve at, you see, in detail about many other things. But let us now pledge to work for serving humanity in future times in a more scientific manner. And as our Prime Minister has been repeatedly talking at all forums for India, he has given a call for an Atmanirbhar Bharat. He is talking about all the activities around respecting the green movement and working once again collectively for issues like global warming and climate change and reviving our respect for the mother planet. I think that is what, if we can resolve and pledge, at least in our own, for our own lives, start practicing what we are preaching. And I am sure that if people at the Boston Center of Excellence will take a lead in this, because you have a good quality reputation, not across America, but of course across India also. And I would also use this occasion to welcome all the, and in fact extend an invitation to good quality researchers, committed people all across the world, and particularly in the American universities, and more particularly the Indians who are there, that India under Prime Minister Narendra Modi is a changed India now. Or whether it is a medical professional or a scientific researcher, there is a changed environment. It's undergoing a revolutionary change. There is a huge innovation ecosystem. There is a huge, you see, technological revolution happening, and there is a huge, you see, startup and stand-up movement growing in the country. And there are a lot of schemes that have been announced in the science and technology forums to welcome such Indian researchers come back to India, or maybe come back for a short time, deliver, learn, share the experience. And then India's thinking and ideology has always been that the whole world is one family, and we all have to work for serving humanity at that global level. Prime Minister has asked every Indian, appealed to every Indian to dream about delivering a new India to all Indians by 2022. An India where everybody has a smile on his or her face. We can give adequate, good quality education, health facilities, and nutritional support to every child. And we can also ensure good quality security, safety, and self-respect for women and our older people. And there is only one ism that he wants to prevail in India, that is humanism and nationalism. I'm sure that India has the potential to actually help the whole world in developing a better, safe, healthier modern world. So with these few words, I once again thank all of you, Professor Balram Singh ji, and all your colleagues and all the distinguished speakers. My greatest respect for all of you. Thanks and my good wishes on behalf of all Indians. Namaskar, Jai Hind, Bharat Mata ki Jai.
Engaging, compassionate, and insightful address and session. We look forward to your guidance as we move forward from here. Under your leadership, the best of the East and the best of the West will come together to see an end to this pandemic. With that, once again, I'd like to thank you, Dr. Saab, for your valuable time. In spite of being a Sunday evening, you have spared so much of time and addressed us. Thanks again. Yeah, I will now introduce the chair of our session, Dr. Timothy McCall, MD, who is specializing in internal medicine and the author of several books, including Yoga as Medicine, the Yogic Prescription for Health and Healing. He is the co-editor of the first medical textbook on yoga therapy, The Principles and Practice of Yoga in Healthcare. It's an honor and privilege to have him as a chair of this session. Dr. McCall, please take over. Thank you.
Thank you very much. And I want to thank Dr. Vardhan for a wonderful talk as well. I've been trying to follow the India COVID situation from afar, and I got more information in a compact format in the last half an hour than I'd been able to get before that. So I'm very, very appreciative. Also, of course, coming from a medical colleague. So I thought, since we have very distinguished speakers, I wouldn't take too long to introduce, but I wanted to raise a couple of points, and perhaps the speakers will want to respond to these things in their talks. You know, I was looking at one of those world COVID maps with it that show the red dots where there are outbreaks, and the bigger the dot, the bigger the outbreak. And I was really struck because you look at the picture of the United States of America, and it's pretty much solid red. It's just red everywhere you look. And you look at Canada. Now, I'm about 25 miles from Canada, where I am here in Vermont. And Canada is gray, and there are about 5 small little dots in Canada. Now, obviously, these two countries that have so much in common and are geographically right next to each other have taken a very different approach. Now, one of the things I teach in my yoga as medicine workshops, that is when I'm traveling to teach those workshops, which hasn't been happening this year, but one of the things I teach is that our happiness, our personal happiness, is related to the story we tell each other about our lives. And it seems to me that there are 2 stories that are being told. One of those stories, we're all in this together. And, Dr. Vardhan quoted the Sanskrit saying, Vasudhaiva Kutumbakam, which I was very happy to learn when I was studying Sanskrit in Bangalore many years ago. And just this idea that the country is a single family. And so anyway, it seems to me that these 2 stories that we tell regard COVID and many other things. One is we're all in this together. And the other story is we're all against each other. You know, and it seems to me that how we go forward and how we learn from COVID-19 and shape a better world going forward depends a lot on that story. And it's been actually super encouraging to see, for example, medical researchers share data in a way they didn't used to do, and establish all these international collaborations for testing and vaccine and clinical care and so many things that have allowed the mortality rate, even in countries where it's high, to drop quite a lot in the last 6 months. And that partly has been this just incredible opening of sharing information and strategies around the world, which has been really heartening to see at a time of some other disheartening things. The second point I want to make, and perhaps particularly the people who are more going to talk about Ayurveda may want to respond. But one thing that has struck me as a physician looking at COVID-19 is that the risk factors for bad outcome beyond just advanced age when the immune system is maybe not working as well are things like high blood pressure, type 2 diabetes, insulin resistance, obesity. We've named a half dozen different conditions which seem to be the primary risk factors for death and a bad outcome in COVID-19. What I think people fail to realize is that all those conditions are part of one condition, which is known as metabolic syndrome. And metabolic syndrome is a dietary disease. It is caused by an excess of sugar and simple carbohydrates, probably contributed to by low quality oils. And essentially from a yogic and Ayurvedic perspective, it's from eating tamasic processed food. So this, of course, creates ama, this interferes with immune function. And I wonder if our speakers might address how we might shape a world going forward where better food choices are available and attractive to people. So the first person I'd like to introduce and who I'd like to respond is Vamadeva, Dr. David Frawley. He, as you know, is a Padma Bhusan recipient, author of so many fabulous books. He doesn't know it, but he's actually been a major teacher to me because I've read so many of his books, and I have managed to get audio recordings of some of his trainings that I wasn't there for in person, including one he did at the California College of Ayurveda, which I've just been listening to the last recently. So anyway, I'm so grateful for his teaching in Ayurveda, yoga, tantra, Vedic knowledge in general. Vamadevaji, please.
Namaste, Shri Gurubhyo Namaha. It is my great honor to be with all of you and to follow our honorable minister from India, Dr. Harsh Vardhan, who has done so much work in the medical and ecological fields. I want to thank Dr. Timothy McCall for introducing and overseeing this event, and Kanchan Banerjee and the Boston Center for Excellence for all the great work that they have done. Now, what I wanted to address, I'll try to put it in this context also, was the role of prana, mind, and consciousness in medicine. We were talking about human development, but we are also focused on the COVID issue overall. I was in India into March. In fact, we decided to come back on March 10th, as we were originally scheduled to come back on March 23rd, and that ended up being very fortuitous for us. At the same time, we saw that India was better organized and aware of the COVID than California was. San Francisco, where we came in at the airport, was very different than India, where so we do have to honor what has gone on in India. And I just want to make a quick point here, because the media is often very distorting or potentially mischievous, because they often say, well, India has the highest this and India has the highest that. There are more COVID patients in India except the United States, things like that. They never bring in the population factor. India is 1/6 the population of the world. It has a population greater than all of Africa, several times more than Europe or the United States. So the actual per capita figures are low, and we must bear that in mind and honor what India has been able to do, and also honor that India has brought in factors like yoga and Ayurveda, and there's a tendency to bring those or to avoid those in the West. And to follow a little bit with what Timothy was saying, essentially, obviously, the issue is that people with weak immunity have greater susceptibility to the disease. And this immunity may be based upon age, it may be based upon certain comorbidity symptoms, particularly the cardiovascular system, the lungs, and of course, rooted in diet and rooted in lifestyle overall. And so besides the general issues and the specific issues of treatment, we have the issues of culture and human development going on that I would like to address to some degree. And I would also like to say that the COVID is a defining disease. You know, the last century had horrible World Wars II. It had a Cold War, it had a depression, so many things, and yet we see some development in technology, so many things were able to occur anyway. So this is a defining moment for the century in terms of our overall development through the century, who we are as a civilization, what our values are, and above all, what our view of life and what our view of medicine is. And it's curious that our great challenge for civilization is a medical challenge, first of all. This is not to say we don't have social, political, economic challenges, but not to the same degree. And it is also reflecting an ecological, environmental, or even lifestyle challenge. And it is part of our new technology. Our technology, information technology, has given us wonders. That's why we're speaking here. It has also brought developments in science, communication in fields of yoga, spirituality, and all of these different forms. But it has a downside as well that we have to address. One, it is part of a kind of alienation from nature that we have developed. Damage to the different ecosystems that we have, loss of quality in terms of food, environment. Often in our urban environments, the quality of food, air, and water, the real factors of life, have been diminished, while the quality in terms of technology, media, and other factors may have gone up. So certain questions are arising relative to civilization as a whole and medicine as a whole. And right now, most of us are in highly artificial, electronically defined environments, rather than in natural environments defined by prana. I am lucky to live in the mountains in New Mexico, high elevation, away from the city, away from the people, where we still have the prana, the sky, the nature, the ecology intact. Although curiously, we are suffering from one of the worst droughts that we have ever had. We've seen almost no moisture since actually March. A very curious thing has gone on. So we need to look at broader issues, and modern medicine, for all of the good things it's done, has also tended to define human beings more in terms of chemistry and also in terms of structure, physical, highly physically based medicine and chemically based medicine. I'm not saying there's anything wrong with this. It's particularly helpful in acute conditions, surgery, injuries, contagious diseases. All these things are there and where it's very useful. But we also need to develop an appropriate psychological, and I would even say spiritual medicine, and also pranic medicine, because we have greater challenges environmentally in terms of our lifestyle as well. And this is where yoga and Ayurveda can give us so much. And on one level, I want to make a very simple statement. We cannot have immunity at an individual level or even at a collective level for humanity. If our biosphere, the pranic integrity of the planet, is compromised, species are lost, forests are lost. So what we are also seeing in the degradation of immunity is environmental, lifestyle, as Timothy said, also relative to food, which is the foundation of life. And unfortunately, in our social distancing and necessary stay-at-home policy, we're not always getting the adequate prana or connection with nature, particularly in our urban environments. And so we must recommend pranayama and meditation for everyone during this COVID era, as well as immune boosting herbs and positive lifestyle, positive way of life communication. Even the wearing of masks can tend to block the prana, so we need to compensate with pranayama morning and evening. And all the artificial electrical impulses can also disturb our nervous system and our vata dosha in particular. Although we have to say that there's a lot of kapha dosha behind this disease, people who are overweight, who have lethargic or lack of movement or sedentary lifestyles. That is also an issue going on there. But we have to compensate and bring more prana, more positive sensory impressions, and more positive emotions into our lives. Yoga and Ayurveda are medicines of prana, mind, and consciousness, or Atman, not simply just medicines of drugs, chemistry, or even herbs. These have a very important role, of course. And this is what we have to bring in mind. We need to adapt and integrate modern science with the yogic and Vedic sciences of prana, mind, and consciousness. And the Vedic teachings show us or tell us that we are not just chemistry, matter, structure. We are governed by overriding holistic forces extending through the environment and to the universe as a whole. Prana is the overriding force behind the physical body. It is not simply a result of chemistry. In yogic thought, it comes into the body at birth, it leaves the body at death. Prana itself doesn't die. Our prana, which regulates as a holistic force our body and mind as a whole, is also connected to the prana of nature and also to the universal prana overall. And we must keep this in mind and nourish that prana. Pranayama, positive sensory impressions, food that has prana in it, not just the necessarily vitamins, minerals, or chemistry, and interaction that is strengthening prana. Then yoga and Ayurveda recognize the role of mind, mind-body constitution, mind as the governing force behind the nervous system. Manobhasrotas, we have a mental system of channels behind the physical system of channels. And mind through emotion, and by the way, emotion is strongly connected to prana. In fact, all emotions arise from basic pranic urges. Fear as kind of self-protection, anger, desire, all these things are reflecting different vital urges. And then they imprint us at a level of individual or ego and at a level of collectivity. And emotions greatly impact and can imbalance the physical body, anger disrupting and imbalancing the pitta dosha, fear disrupting and imbalancing vata dosha and immunity, ojas overall, attachment, greed, possession, lack of movement impacting the kapha dosha, and then bringing that heaviness, inertia into the body. And Yoga and Ayurveda also emphasize the role of the three gunas, Sattva, Rajas, Tamas. Timothy has already spoken of how much the guna of tamas has affected us. In fact, often we think, oh, in the modern world we have lots of rajas because we're always moving, changing, watching things. But the fact is we have a lot of tamas, a lack of physical, mental movement, and also tamas in our food, old, processed, recooked, artificially done, lack of pranayama, lack of thinking. So there is a lot of tamas. We're not living our own lives. We're living by proxy, by our leaders, our entertainers, all of that. We then have an epidemic of depression that's going along, and that's before the COVID condition, but it's also being strengthened by it. And to put that very simply, what is the cause of depression is very simple. It's stimulation. The more stimulation we come up to, the more stimulation we have from the outside, we become more lethargic inwardly, and we become more dependent upon that stimulation. That stimulation has to be increased. And if it isn't, and even if it is, we always end up having some need to have greater stimulation, or we fall into depression. Remember, as a child, we would see movies with one car wreck. That would be a big thing. Now we have movies that are one car wreck after another. We have action movies, the total stimulation. What is the poor person doing watching the movie? They're doing nothing. Often when I'm around people who are watching something on the screen, entertainment-wise, I say, well, what are you watching? And they say this or that. I says, no, you're watching a screen. And the mind tends to become what it watches. So we are now becoming screens. We are now becoming cell phones and boxes, which is, again, limiting our prana. And from the standpoint of mental health, the mind needs space. We're losing the third dimension in our watching of things, which is losing the depth perspective in our thoughts. And that is why we need meditation inwardly to create space. And we need to go outside and look at the sky, the stars, the clouds, the rain, whatever is going on there, to create the healing space for the mind. Mind also heals itself where there's solitude. A lot of social stimulation is helpful to a point, but the mind needs solitude, space, and silence to heal, to grow, and also to develop its higher potentials. In our view, yoga and Vedanta, the mind also doesn't die. The core of the mind, its samskaric and karmic patterns, will go on to the next birth. The outer physical aspect of the mind will, of course, go with the physical body. And there is an overall unitary mind, along with the unitary prana governing our mind, body, and allowing for the harmonization of the mind, body overall. And the mind can produce, and with the prana, its own secretions, its own through pranayama, mantra, meditation. We can also change the brain chemistry. We don't have to go through outer chemistry alone, changing our food, how we breathe, the type of sensory impressions we are taking in, meditation, mantra. Mantra can change the structure and format and movement of the mind. And we also see in the COVID era, we're having the depression, the anxiety, the panic, the fear, which are also collective reactions. Mind is largely collective, and through education, we can also see how we have epidemics of the mind. So there's also this, not only with the COVID, a physical epidemic, but there are also various mental epidemics and distortions, disruptions, emotional issues that are also leading to social problems in the society and psychological problems within the people, even those who may not have the physical disease. We, of course, have all these post-traumatic stress disorders that have gone on in various ways. These come from the mind, and we are not taught control of the mind, and we are not developing power of attention. We have a split-second attention to watch all these very quick things. Power of attention is necessary for power of prana, power of awareness, power of immunity. We need the psychological immunity of a strong inner sense of self and of a strong power of attention. And this then leads me to consciousness, which is the ultimate science. And the Vedic yogic science of consciousness, we also need to adapt and develop. We can study it outwardly through chemistry, through studies, through brainwaves, all of that's extremely important. But the ultimate study of consciousness is within our own minds through meditation, our own direct experience. This also needs to be brought into our lives and brought into our schools. And Yoga Vedanta have this very significant power and study of consciousness and all the tools for developing consciousness through control of emotions, control of the senses, pranayama mantra, meditation, self-inquiry, introspection at various levels. This is a very key factor that we need to develop. We need the science of consciousness to go along with the modern science. So we have the inner awareness, the development of the buddhi, or the higher intelligence, to use our technology from a place of spiritual integrity and universal awareness, rather than simply being driven by commercial, political, or ideological forces. We are coming into this era of artificial intelligence, which is very good for helping our lives. But we shouldn't let artificial intelligence rule us. That will then reduce us back to levels of machines. Our knowledge shouldn't be just on our computer or our cell phone. We have to memorize it. It has to be within us, and we have to meditate on it on a regular basis. And this is what the yogic sciences offer us, that science of consciousness. So we need to see the integration of Ayurveda and yoga with modern medicine relative to doshas, gunas, prana, mind, consciousness, and also recognizing higher states of awareness beyond our ordinary states, states of inspiration, art, samadhi, ananda, higher happiness. If we can create that ananda within, we won't fall into tamas. We won't get caught up in this drug addictions, which is another very important part of the health challenges relative to the COVID, or the media addictions that we have, or the food addictions. So it is very important that we also bring back that yogic Ayurvedic science of prana, mind, and consciousness. I know our time is limited here. I will then just summarize my point of view so that we can go on with this discussion. I'm not criticizing modern science. I'm saying that we need to integrate the outer sciences with the inner science of consciousness, give each their place, use our technology to raise ourselves, at the same time protect our prana, our environment, our inner awareness, develop our behavior, our values, our dharma, have lifestyles integrated with nature, gardens, flowers, rituals, art, music, mantra, meditation, creative activities. And we can certainly do things for the sake of the outer world, be aware of things as the media do these wonderful webinars and all of that. But we must hold to that core inner being, our true self, or Atman, that is one with the self of all beings. And we must honor that self in all beings. We must bring it into medicine and recognize that is the ultimate unitary force, universal self, universal consciousness, universal prana. We can access these for healing and transformation within our lives, within our society, and we can have the ultimate spiritual immunity that can guide our lives. And the challenge of the COVID virus can be used to bring us to higher levels of ecology, prana, awareness, natural, medical, yogic healing, over all. With those words, I will close, and I look forward to hearing all the other speakers. Shri Gurubhyo Namaha, Hari Om Tat Sat. May all beings be happy. May we go beyond all diseases. And even if we have to suffer disease, may we all connect to the divine light of bliss, Satchidananda, within us.
Great. Thank you so much for that inspiring talk, Dr. Frawley. Next person we're going to hear from is Dr. Balram Singh. He's obviously well known to everyone here, the chairman of the executive board of the Boston Center for Excellence, a scientist, a professor, fascinating interests, protein structure and folding, biodefense agents, innovative biotechnology. So we very much, and of course, yoga Ayurveda as well. So we very much look forward to what you have to say. Please proceed, Balramji.
Thank you very much. Am I audible? Am I audible? Can I share my screen, please? Can I share my screen, please, Mahendra?
I think there's a button down at the bottom of the screen you have to press. The middle of the five is the share screen button.
Got it. It was wonderful to hear Dr. Frawley, Bamdevaji, and particularly the thing that I noted him talking about that when people are watching sports, or they think they're watching sports and movies, actually they are watching a screen. So I think that's such a wonderful statement, because and he did appreciate science and coming from biochemistry background. Actually, there is a huge difference between watching a screen and doing the sports. And when there is a disbalance in that watching and doing, that is the body-mind difference. And there is a chemical basis as to what happens. And many times there are so many chemicals being released, which would not be released when you're not doing something. And that actually causes more disease and problem and disbalance. So, and that's really the basis of Ayurveda. And I'm putting this picture here just to remind, even though I think the audience as well as the panelists know it very well, including you, Timothy, obviously. But just to know that there is a body and there is a mind and there is this all other things around us, which makes the prakriti, and the balance has to be in all of them. If it is no balance, then there is a vikriti or disease or disorder. And I want to just emphasize, this is just a model for Ayurveda, and mostly we think about human health, but actually this involves everything, the entire universe. And when we talk about COVID, I know we are talking about more about post-COVID-19, but this something that has been there and will always be there is that when there is a balance, you have much better innate immunity. And then you are able to live with everyone, everything, including corona, in harmony. And that is very important. And this can be more introduced in terms of the Indian Vedic concept of Vesti, which is the human mind and psyche, that then extends itself into the society and environment around us, and in whole samasti. And this needs to be, in terms of thermodynamics, this is considered a system and surrounding, where we can have the system as us, and the rest of it is surrounding. We can have system as society, and rest of it as a surrounding or environment, and so on and so forth. And this is the same concept when system and surrounding is in resonance, then the concept of yat pinde tat brahmande occurs. And this is a realization, this is not given. And so there is an effort one has to make for human development. And I think that is the crux of what we ought to do and what we need to do. And so I'm going to talk about, coming up, Vamdevaji and Honorable Minister both talked about India and its efforts. And of course, Timothy, you also mentioned about your experience. So this is something very interesting about science and scientific, although sometimes people think about the spirituality to be different than the science, but I think a little bit different. And I think Indian people also think very different. So Indian constitution is the only constitution that I know of, which is talking about the fundamental duties in Article 51A, that talks about that it is the fundamental duties of the citizens of India to develop the scientific temper, humanism, and the spirit of inquiry and reform, which means anything and everything can be questioned and then move forward. I think that is probably a best way to look at the society. We're not talking about believing in God or any other things. Just look at everything scientifically. And then science has been well defined as a systematic, non-falsifiable, objective, and unbiased or detached study, which is a very important aspect of looking at the life. And I find Ayurveda to be, this is nothing, much of the time discussion is that whether it is going to be India, everybody has to listen to India, everybody has to do everything that is done in India. No, I think Ayurveda is one principle that talks about it's the local. Everything has to be local in local situation and local conditions and local herbs. So it is a system that I think, though, India has mastered, and I think it has a responsibility of not only nationalism, as the Honorable Minister said, but I believe that it should be internationalism. In the spirit of duty and responsibility, it's our duty to help humanity. And in that sense, I think it should be internationalism, not just the nationalism. And there, one has to find it very important, and again, the people on the panel know it very well, when there is a religion, then there is a lot of dispute about things. But in India, Patanjali Yoga Sutra says that Ishvara is you, not God. Actually, you just need to practice. Klesh karam vipaka asai paramishta purus vises Ishvara. When you are away, you are detached, you are beyond the karma phala and the klesha, which is the raga and dvesha and papa and punya, then you reach the level of Ishvara yourself, which is very different. And how do you do that? Well, there is a whole process of yoga where the yoga, chitta, vritti, nirodha, just Vamdevaji just talking about the mind and chitta. And then only you can understand by doing action. You can do not by watching a screen. Tapah swadhyaya yusara pranidhanani kriya yoga. When I do things and then feel all that and have the devotion to understand what you're doing, and you are beyond the rag and dvesh and pap and punya, then you reach an understanding of what Ishvara is. And then only you can understand what Swadharma is, and then you can develop yourself. Your karma will be developed, you will be free. And when you are all that, then you are in yourself, established yourself, and that is the swasthya, or the health. And that also is the equality. So the freedom, independence, and equality, which is the treasured value of United States of America and the rest of the world, I think can be obtained by this, by developing human beings, humanity in this manner, not in any other manner of somebody giving rights and given the resources. And then one of the studies that has been done in science, Vamdevaji, is that there was a study in 2009 that published about God. And they looked at what on some moral values. The study was published in the prestigious Proceedings, National Academy of Science. It was asking moral values, whether my values are same or different than American. And they really did the recording, so they didn't just ask the question. They just found out what is happening in your brain. And they found that there is a difference between when a moral values as to what I think and what a typical American thinks. They also thought what God thinks and what typical American thinks. They found more differences, orange the dots, so higher numbers. when they ask them the question, what one you think and what God thinks, no difference. And this is the definition of Aham Brahmasmi. I mean, whether they believe in it or not, this is just a natural thing. Everybody has their own projection of the world. And that is very important to understand, because people have to take the responsibility. Now, this is an idea in Upanishads that Schrodinger, who's Nobel laureate for quantum mechanics, had identified, written in his book. So I'm not going to go in detail, just to highlight that point. We also see that yoga practice and in today's world of stress management, from my group, we just published a paper where we try to correlate yoga practice and stress management, spiritual belief as a moderator, whether spiritual beliefs are important. And it is very important to understand some of these things, because you only hear about people from religious groups talking about, not really from scientific perspective. And in this one, I wouldn't go into detail, obviously, just only highlights of it. We looked at the effect of stress on life and how the spiritual belief had anything to do with it in yoga practice and management of the stress. And we had about 251 individuals for this study that was done. And we found that actually the effect of stress on life, both for spiritually low, the people have low belief in spiritual, or are high, they both correlate with yoga practice. The one which have higher spiritual belief, they actually have higher yoga practice. But to manage stress, people who have, even who do not have any spiritual belief, they practice yoga. So yoga is coming out to be a quote-unquote secular practice where people are trying to understand themselves, which is very important and I think very welcome. Talking about chemistry and science that Vamdevaji also mentioned, yes, there is a structural chemistry. My group is part of it. We do work in that area of drug development and other things. But also, there is a process, equivalent process in Ayurveda, although the path is a little bit different. So they also have a methodology. It's not like I just simply, somebody thinks out of blue and does it. There is a methodology. There is a combination of natural herbs. There is a sense, the karmendriyas and gyanendriyas. And then there is a value to all that. And then ultimately, Ayurvedic products are developed. But then one has to understand the functional chemistry, which is what happens really, what these herbs have, and what the functional diagnostics is. And so I have tried to coin with ideas, depiction of steps in Ayurvedic drug discovery and development as sensory chemistry, because you have senses involved. But actually, I think that's not enough, and I think more study needs to be done. This is just my future thinking, that we are talking about Tanmatra chemistry. So future of the society and drug development probably will be more on Tanmatra chemistry. And then there will be evidence that normally people talk about Ayurveda, there is no evidence. I just want to give a couple of examples of the beauty of Ayurveda science. And that's not understood, is not even approached, in my opinion, at this point. Tulsi is one example. And what my group has done some research on this, it has found its effect on some cancers, nerve cancers. And we found that when we are looking at the genes, Tulsi reduces the genes, the amount of genes that normally promote cancers. So you have 3 genes here. They're when you treat with this number of 50 nanogram, 100 nanogram, 200 nanogram, 300 nanograms, you can see that there is a gene expression has gone down. In normal cells, it doesn't happen. But a very interesting thing is Tulsi also does, if there is already a cancer, it increases the gene that brings that cancer cell back to normal. And this is happening in the same fraction. It's called, we have this osmium fraction number 1, and that we have found that in fraction number, this is the fraction number 1, and that has molecules that determines both the preventing the cancer and also bringing the cancer back. What a beauty, what a factory, what a drug factory that it has, and what a system it has created. That's called Tulsi. There's so much more to learn out of it. The same way, there is so much report about Bhasma being a very toxic substance, but actually Bhasma is not the same as heavy metals. So we have tested that. Bhasma actually Those of you know obviously Sanskrit, and Timothy also mentioned that he learned Sanskrit. Bhas means nistej. It means detoxifying. Actually, bhasma word itself means detoxification. But because they translate as ash, then they don't understand that they think it's ash of metals. So this is very important. We tested it. Actually, we found that there is no toxicity at all in bhasma. And I'm not presenting data here, but when we made the same nanoparticles from the modern chemistry method, that was highly toxic. So the concern is right, but I think the translation is wrong. And actually, it's not only that, bhasma also acts as a bioenhancer. So it's more than just non-toxic. Because you wouldn't just use just because it's non-toxic. It has a value. And I think this kind of research in science needs to be done. With this graph, I just want to show that plants have the consciousness the Bamdeva is talking about, not just human beings. Plants have consciousness. And here is one of the examples when we put a red pepper in the middle surrounded by the green peppers, and then we found that the red pepper, the other surrounding green peppers also start becoming red, not in the green one. The same way is about the tomato. So plants have, they see each other just like you and I see, whether we see through a screen or through fields, but that they also have the consciousness, and that is very important to recognize. Once we recognize something like that, then we can develop a science, the science that we will be able to have the integrative science. It's not a question of science versus spirituality, not science versus Ayurveda or Vedic knowledge. It's not like that. I think it's all connected. There are more than one way to look at science, and this is one of the ways, the two ways that normally people look at inductive and deductive ways. For example, experience observation based, when you do something like I just showed you about data from Tulsi, that will be a deductive science because I made an observation and we are looking at eventually get theory. Or quantum theory is the first theory has been made and then people eventually trying to confirm. And but interesting thing is these are the two forms of text in India, agamas and nigamas. Both of them are present in Indian tradition. And agama is the one, yoga, saiva, local tradition, Ayurveda will be this all based on experience observation. And nigama will be Vedas. Vedas are considered pramanas, as are Bible and Quran. People, those who follow them, their contents are different, their procedures are different, but they nevertheless have the nigamas or the theory first, as they would say. And it's interesting, very interesting thing is how we practice this. So in agamas, you practice, you look at the moon and you find out the fortnights of the dark and the light fortnights, Krishna Paksha and Shukla Paksha. But in nigamas, going on the Bible, that said that the world has been, the days have been, or the months have been divided into weeks, and weeks have been divided into 7 days. There's no connection to anything natural. So this is a natural observation, whereas the other one is not. So, sometimes if you want to live naturally, then you have to think about connecting yourself with the nature. And I think this is my last slide. I got a couple of minutes, I think. So how to translate all these things in the society? Because I like I said, there is a bestie and there is a semesti. And the environment around us is also affecting us equally. It's not like only I can do whatever I can do. I think the surrounding is also going to affect us. So there were Mahatma Gandhi had some ideas, and one of his ideas was that if we want to change the world, we should be changed ourselves first. Einstein also said, Albert Einstein said the same thing. Example isn't another way to teach. It is the only way to teach. So I think we need to practice what we say. Then Gandhi's ideas of values were universal values, like I said earlier, independence, freedom, equality, satya, the truth, ahimsa, and non-violence. And then he had political views where he talked about Ram Raj from Gram Raj. Now I know this is Sanskrit. Ram Raj is a concept of where there would not be any injustice. Gram Raj is a local. Basically, it means village, governance of village. It means a local. And in United States, in my opinion, practices a little bit more of this than even in India, even though India talks about it. And then personal values has to be self-sacrifice. And this is the system in which democracy that we are seeing today, even though we value it very highly because our opinion are at least is taken, if not counted. But democracy divides people. As we can see all over the world, democracy divides. The Prajatantra is the idea of where you have self-reliance, you have freedom. Freedom comes from self-reliance. And I don't have time to go into detail, but anyway, that's a system of Ram Raj Prajatantra. And it's interesting, the League of Just was same as Prajatantra. League of Just is something that Karl Marx joined early on in his life, and then he eventually turned it to League of Communists. So this is a very different kind of system that we are talking about. But Mahatma Gandhi talked about the learning through crafts. So you become self-reliant, and then you be independent, and then you can give your opinion. Otherwise, it doesn't matter really that much. And so he wrote a book in I believe in 1909, Hind Swaraj, in which he criticizes very heavily. And it will be very interesting Corona time to think about that. He talks about civilization. Of course, Western civilization, he thinks it was a disease, very openly about it. But he means civilization is that mode of conduct which points out to the man the path of duty, and so on and so forth. So doctors, lawyers, machinery, engineering, all this that we have been talking about this earlier, I think this comes into that area, and it's very important. And I think I will stop it here because I think I have taken my time that I needed. We are running late anyway. So thank you very much for listening to some of the stuff that I had to say. And I will be so happy to share some of these ideas maybe sometimes in the future again.
Thank you so much, Balramji. Fascinating talk. We have one final speaker today, Dr. Jerry Solfvin. He is a professor at the Center for Indic Studies at the University of Massachusetts in Dartmouth, Massachusetts. And we very much look forward to what you have to say. So please proceed.
Yes, hello, and I'm delighted to be here. I'm honored to be here with this group of people who are really scholars. I'm not much of a scholar myself. I'm a methodologist by training and by inclination. So I dabble in statistical thinking. I dabble in how we learn and how we know things and how to construct an experiment, how not to construct an experiment. And once people come to a conclusion about things, I have no more interest in it. My interest is in mystery. I am interested in the mystery of the world. I try to encourage more scientists to take that point of view because scientists seem to be more interested in answers these days and their own answers, coincidentally. But I'm not interested at all in answers. I'm interested in mystery. And so I go to the places where there is mystery. A place that I am going to recently is narrative. And I've become quite fascinated by the mystery of narrative and how it interplays with our lives, individually and collectively. That's my topic. And I have to say that I'm so impressed that my topic has been covered almost completely by Dr. McCall, Dr. Frawley, and Dr. Singh, who have already covered this idea of narrative so well that I'm not sure I have much more to say. But I have a particular niche in speaking of narrative. That is, there seems to be an unawareness of the power of narrative. I know I myself am guilty of that, or used to be. I still am to some degree. So that's my sharing today, is to raise awareness about the power and importance of narrative. I want to do it very quickly. So we begin with May of 2005. And in May of 2005, a commencement address in college in Ohio by David Foster Wallace, a well-known author, professor at another university, and wrote many books and many short stories, and was very well known for his literary genius. As fact that particular commencement address, the Kenyon College had about a dozen possible commencement speakers on their list. Amongst them was Hillary Clinton and astronaut turned Senator John Glenn. And both of those were superseded by David Foster Wallace. And that was a very fortuitous event, because David Foster Wallace gave a 22-minute talk, which is readily available and highly recommended to any educated person in any field of activity. And that is available widely on YouTube. It's available in print. And that a couple of days after David Foster Wallace presented his 22-minute commencement speech, the Wall Street Journal published it word for word on their front page because it was so powerful. Shortly after that, Little Brown and Company put it into a hardcover book I think they called it "This Is Water." So what makes oh, by the way, did I mention that Time Magazine called this one of the top 100 pieces of literature of history in all of the history of humankind? Okay, so this is a very special commencement address. What makes it special? So I like to introduce narrative by talking about the essence of what he said. He gave this example, this story, this narrative. Two young fish are swimming along happily one day, and they come across an older fish. And the older fish says, "Hey, boys, how's the water today?" And the two young ones say, "What the hell is water?" So that's where we are with narrative. We are immersed in a sea of narrative. And when we say, what is narrative, most of us don't really fully understand. I know I did not. How powerful and how all-pervasive narrative is in our individual and collective lives. So I'd like to share that with you. David Foster Wallace was not the first one to realize that, of course, and I'm not sure he had that as his point of view, but he uses it effectively as a start of his very highly recommended commencement address, which I hope you will all look up if you haven't already read or heard it. Jerome Brunner in 1999 was 1989. I'm sorry. Wrote an essay called "On Narrative and How Narrative Creates Reality," and I think that title is the essence of how powerful narrative is. Narrative is the sea in which our thoughts swim. Narrative is the sea in which our thoughts swim. We tell a story. Well, what do we mean by narrative? Well, by narrative, we mean the Mahabharata. That's an outstanding example of narrative. The Mahabharata is many, many stories, all put together and linked together into a much larger story. I think that's an important feature of narrative. There is something connecting about narrative. The narrative is also Greek mythology, Roman mythology. Narrative is also travel stories, Ulysses, the great classics, Shakespeare, of course, but also the Vinland stories of my Nordic background. and many, many other stories. There are many stories that are culturally driven. There are stories of origin, how we got here. There are stories of how our family got here. There are stories about how our city got here. There are stories about how the earth got here. There's the Big Bang story. There are all of these stories. There are stories of how people live their life and what's good and what's bad, what is healthy, what is unhealthy. All of these are stories. And the stories include individual stories. Each one of us has an individual story or many individual stories that create us. It was Ramana Maharshi who spoke of and suggested meditating on who am I? Now, another way of saying the same thing from a narrative perspective is, what's my story? What's my story? How did I get here? Who am I? What really am I? Now, that's an important story that each one of us has, and it's separate from everybody else to some degree. There's overlappings. There's connections. Now, narrative, one of my favorite people about narrative and story is Thomas Berry, back in the 1980s. Thomas Berry, a cultural historian. He's also a priest, but he was more an academic than a priest. As a matter of fact, instead of calling himself a theologian, he referred to himself as a geologian because he was geologically devoted. He was devoted to what was happening to our planet. He was an avid ecologist, and his main point was that there's something wrong with our collective story. There's something wrong that we are destroying each other, that we are destroying the environment, that we are destroying our own consciousness, that we are destroying our bodies. We are destroying collectively so many things because of our story. We have the wrong story. So he argued long and hard and wrote a number of books on the issue of creating a new story. We need a new story. What was wrong with the old one? Well, there are a number of things, but one of those main things, which is also captured by Robert Lanza of biocentrism fame, is the old story, the story that we still live by, is a story of separateness, is a story that I am different and separate from you. Not different, but I am different, but separate from you. I'm separate from the organic materials all around me. I'm separate from nature. I'm separate from my neighbors. I'm separate from the animals and the plants and the rocks and the rivers and the atmosphere and the sun. I'm separate from all that. They're different. They're out there. So the old story is one of separateness. The old story is one in which I elevate and believe in a separate I, and everything else is just relative to the I. In any case, a curious thing is that when we meditate, as Ramana Maharshi suggests, on who am I, or Sam Harris, neuroscientist Sam Harris, who's an ardent, lifelong meditator in many traditions and student of meditation. When Sam Harris meditates, he writes about that we lose this I. our own personal narrative goes away. There's a long history of narratives about this. In my Nordic tradition, there's the Peer Gynt narrative. It's a folklore. And Peer Gynt was a seeker after truth. And when he found over and over that he couldn't come to any truth, in his frustration, he ended up in an onion field. And he said, here, finally, I will find truth. So he takes an onion and he peels it layer after layer after layer. And of course, there's nothing in there. It's only the layers. So that fits with this idea, which has both ancient wisdom and modern science behind it, to remind us that the self, this thing that we so highly value, is in fact an illusion of sorts. Now, I'm interested in it because that is a mystery. And that is one of the greatest mysteries that we have, the mysteries of consciousness, the mystery of who am I? So I have no answers to this, but I'm fascinated by the mystery. And I think that one of the pieces that will help us understand it is narrative. The final piece is to what I'm saying. And the action item is Ashtanga Yoga. The action item is to do what Ramana Maharshi and many, many others have advised us to do, and that is to meditate, to go inside and find the onion, peel the layers, to go inside and ask, who am I? What is my story? To dig out and become aware of how many stories each one of us is and is controlled by in so many, many ways. And so that's basically all I have to say. I want to also say that I love Balram Singh's tomatoes and peppers experiment because it says so much about the new story, the story of not separateness, but non-dualism, if you will, the story of connectedness and harmony. So I have one final story to end with, which I got from a wonderful writer named Stephen Harrod Booner. Stephen Harrod Booner, who writes a book, he's many books, but one book that I really enjoy very much is called The Secret Teachings of Plants. Kind of interesting title right off the bat. Booner cites an experiment. It's a thought experiment. Let us take one heart cell or a stem cell that's destined to become a heart cell, if you wish, put it into a petri dish and watch it. What happens? Boom, 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 boom. It starts beating. That's its dharma. That's its destiny. That's its work. That's its purpose. Now take another heart cell or stem cell destined to become a heart cell. Put that into the same petri dish. Boom, boom. It shortly starts spontaneously, without having to trigger it, to beat. amazing. What happens next is even more amazing. Ba-boom, ba-boom. The two heart cells start to synchronize together and beat together. So modern medicine deals not any longer with the brain, the heart, but the brain, heart, and now we've added the stomach, the third brain, the gut. There's a syncope of these organ systems that are representing the synchrony of all of our organ systems, and it reflects an outer synchrony of a larger world of which we are a part. And that is the new narrative. That is the narrative that I personally need to remind myself of every day when I walk into the backfields with my dog. It's a narrative that I would like to promote and ask other people to raise their awareness to. So you see, I have no answers, but I have a narrative. Thank you so much.
Thank you very much, Dr. Jerry Solfvin. Fascinating talk, very different perspective, but very welcome, very happy to hear it. We are running late, so I'm going to wrap this up. I just want to give a brief final thought. You know, we've been talking about the world being out of balance. We're talking about individuals being out of balance, and the out of balance world and the out of balance individuals contributing to this worldwide pandemic, along with myriad other problems. One of the most fascinating things I've learned from Ayurveda and yoga is that when you're out of balance, when you're rajasic or tamasic, when you've got a vata vikruti, for example, any of these imbalances, things that exacerbate the imbalance feel correct. People who are imbalanced try to tap in to their innate wisdom, and what they hear is not their innate wisdom, but the imbalance speaking. You've got a pitta imbalance, then you like to listen to talk radio because it gets your pitta feeling alive, but it's actually the opposite of what you need to be balanced. And I think the great hope that yoga and Ayurveda help is that by taking people and putting them in the direction of becoming more balanced, then suddenly things that promote harmony and promote better health and bring more prana into their lives, for example, all start to feel like the correct decisions. And of course, that ends up then having these people change their stories. And when they change their stories, behavior changes. And when collectively behavior changes, the whole world can change. Thank you all so much. Fabulous presentations. I so enjoyed this program. Thank you again for the Boston Center for inviting us all to speak in this great event. Take good care. Namaste.
Yes, namaste.
Namaste. Too bad that we ran out of time. We feel so bad that we could have more discussion on this, but we ran over in the earlier session. That's why it pushed us over here. So thank you so much, Dr. McCall, for chairing this session. And it was wonderful to hear from Dr. Frawley, Dr. Balram Singh, and Dr. Jerry Solfvin. Wonderful talks. So we are starting. Pramit is the host, but he actually is on his way to the airport. So he asked me to bring back everybody here. So first of all, apologies to Professor Chatterjee and Professor Wadhwa for this delay. Earlier, our minister was speaking. He took a little longer time than was allotted, but it was a great talk. So I request Professor Dr. Diana Lurie to take charge from here. She is the chair of the session, and I'll just briefly introduce her. It's great to have her on the session. She is part of our advisory board of Boston Center of Excellence. She is at the University of Montana, professor of neuropharmacology in the Skaggs School of Pharmacy. She's a certified Ayurvedic practitioner and is the chair of the National Ayurvedic Medical Association Certificate Board. Actually, Dr. Purnima is here. I thought she was not here, but she was to introduce you. But anyway, she's there. Sorry about that. I didn't see you. So let's continue. Dr. Purnima is part of our board, and she's been very supportive of the work I do. She's a medical doctor also by profession. So over to you. Sorry.
Namaste, Kancha. It's okay. You already did the job, and I know we're running late. I would just say that namaste from Boston to all the conference participants. And my name is Purnima. My expertise are in robotic surgery and obesity medicine. And currently, I'm a student of Ayurveda, Vedanta, and Sanskrit. So not really an expert in COVID or anything else. I'm still a student. And I know already a lot has been said since yesterday by our esteemed speakers. And there's not much that I can say here. An introduction of our coming speakers has already been made, and we are short of time. So with that, I will hand it over to our chair from University of Montana, Dr. Diana Lurie. So there you are, Diana.
Thank you. Thank you very much. And thank you to Dr. Balram and Dr. Kachan for including me in this very interesting panel and discussion. And as I was listening to all the speakers today and yesterday, a couple of thoughts came into my mind, because this panel is on the future of education, science, and technology. And it occurs to me, looking at this through the lens of COVID-19, that our technology has really made some amazing advances. So we think about the vaccine development. This is the first time we've developed RNA vaccines, and we've done it on an accelerated timeline. And so the science has been incredible with this. But in terms of how it's going to be deployed and how it's going to be used, we have people, especially in the United States, who are anti-vaccine. We have problems with distribution. So our humanity and our prana and our narrative stories play into how we can deploy that technology. And another example of this, I was reading an article last night about the new techniques that physicians are using to treat COVID-19. And there was a story of a physician told of a patient on a new type of ventilation, and they were conscious, but they couldn't speak. And this ventilation had been very successful, but was not in this patient. And the doctor wrote and said, "What's the problem?" And the patient wrote back, "I'm scared." And so the physician sat down next to him and told stories. And then eventually the patient wrote, "Oh, the air is flowing really well now." So there hadn't been a change in the technology. There hadn't been a change in the airflow, but the patient felt better and felt more humanized. And so the treatment was more effective. And we see this also in education. At my university, there's been a big push to do a lot of online education, remote education. And what the pandemic has shown us as we've moved to hybrid models is that students crave that in-class, in-person communication. It's part of their maturation process. So technology, of course, has a large part in our lives, but I think that we have to mesh it with our humanity, with our psychology, and otherwise it won't be as effective. So with that, I would like to start our panel, and I'm going to introduce our first panelist, Professor Debashish Chatterjee. And his work for the last 3 decades has been to interpret India to the world. And he is the author of 7 internationally published nonfiction books that have been translated in several languages. He's written editorial columns for many publications. And Professor Chatterjee strives to contemporize Indian thought through his research, writing, speaking, and institution building work. He has taught for over 2 decades in 3 premier Indian institutes of management in Calcutta, Lucknow, and Kozhikode. He serves as Dean of IIM Lucknow and Director of IIM Kozhikode for a 2nd term. He has also held international academic positions as Dean of a global business school in Singapore and has been a senior Fulbright Fellow at the Kennedy School of Government at Harvard University. He is devoted to his Labrador Mig and harbors a secret passion for rain dancing. And I am very much looking forward to his talk, which is The Elephant and the Mouse, the Future of Education in the Post-COVID World. Professor Chatterjee.
And sorry to interrupt, there's a video share. Are you going to do that?
Kanchan, we could, because we're running short of time, so we forget the video. We'll just have a, go ahead. All right. So, first of all, thank you, Kanchan, for inviting me here. You've run the risk of somebody who is up and about and awake on a Sunday evening after a long day's work. And so don't blame me for going out of gear, because I can see 2 very distinguished academics right in front of me. One is Diana Lurie, whose work, of course, is very eclectic, broad range. I was reading up about her, and Vivek Wadhwa, I had a chance to listen to his talk in Mumbai a long time back, and a very wonderful film on the future of work and death, I think. I may be wrong. But then don't expect something from a nearly extinguished professor. And because my work as director for 20 years has robbed me of the subtlety that great academics bring to the world of contemporary world of education, academia. What I will do is, I'm going to talk about a new book that I'm writing. It's called The Elephant and the Mouse. And the Dalai Lama and I had a long conversation on this, and he has very generously written a preface to that book. But before I go to the book, that's not my idea. The idea was to take that metaphor and make sure that we understand the times we are in and the future. So the future of education is about crossing the bridge between mind and life. In short, it is about getting unstuck. I have people who are telling me about the onslaught of technology, how exponential use of technology is going to affect education like never before. I have no issues with that, but I live in a country like India, 1.3 billion people, and there are many Indias here. One is the India of IITs, IIMs. I sit on top of a very privileged space where we have the best of both worlds, the Eastern and the Western. But there is another India where only 8% of people have internet connectivity, where you have electricity 12 hours a day, no electricity. And a large part of India goes to school because there is food there. So fundamentally, we are talking about a very different world where, if I remember right, I heard Dr. Wadhwa say that that India does well in spite of its education. And I'm going to argue that, well, it does in spite of its education and also because of its education. I'll tell you why. And the future of education is, as I said, about getting unstuck. We see that the movement is from mastering those mental models that constitute our disciplines to facing challenges of real life. I think that's a movement that I see happening. And technology is taking learning everywhere, from hardware, software, to everywhere that you can imagine. If somebody is listening to my talk, sitting on a bathtub like Archimedes, I would not be surprised, because I can't see where learning is happening. What I know, however, is that human life, as we know it, comes in 4 broad sets of competencies. You negotiate life based on and the persistent problems of life based on rationality, emotional competence, will, and ingenuity. I haven't seen them improved in the last 2,500 years. And if I put somebody from Aristotle's times or Buddha's time or Krishna's time right here in the middle of the pandemic situation, I think they will cope much better than most of the trained guys from some of the elite institutions of the world, because they have had a fine balance of these human competencies that I think we seem to have lost. And echoing Dr. Lurie's sentiments, I would say technology has amplified our rational and our cognitive capacities, but I'm not sure that it has not diminished our emotional competence, our willpower, even our ingenuity. The story of the elephant and the mouse brings to light a very ancient piece of wisdom, but I think we have to talk the language of metaphors here, because facts are so difficult to defend. So what I would do is I would talk about an elephant that's trying to cross a bridge. And the elephant crosses the bridge. It's an old bridge made up of an old tree. And the elephant does it every day, intuitively. And the bridge is made up of, since it's made up of biodegradable stuff, and one doesn't know when that's going to collapse. But the elephant has nothing much to do with it. It goes along anyway. And that day, elephant sees a mouse hovering around this foot. And the mouse says, "Brother, for you it may be a short journey, but for me it's a long one. Can I take a ride on your back?" And the elephant says nothing, because it can't hear anything. The mouse's voice is so faint and distant. So the mouse takes a ride, gets up on the elephant's back and says, "Brother, since silence is another name for consent, I get on your back anyway." And as the elephant is negotiating the bridge, which is wobbling a little bit, the mouse says, "Brother, my GPS is saying this is the dangerous part. Two of us can get very heavy. So would you be able to mind your movement a little bit?" And he keeps talking to the elephant. The elephant doesn't respond. It just walks as it should walk. And it does negotiate those, trials and tribulations on the way. And as it ends the journey at the end of the bridge, the mouse climbs up its back and says, "Brother, here is my business card. Here is my cell phone number. Call me whenever you need my help. See how I guided you through." And the elephant says nothing. It seems that it heard some faint voices somewhere, but the elephant moves on, as it always does. Now, here is my story. I'm not telling you what the elephant is all about, what the mouse is, or what the bridge is about. That's for you to decipher. I presented the story in all 6 continents, and I can tell you I get strangest of answers, interpretations, what these elements are supposed to be. But I'll rest your mind on that, because I don't want to explain the story spoil if you explain it. So I'll go further. And I'll take you to a place where I sit over a cup of tea. And you can see right now, this is my Energizer with a piece of lime inside it. But then I can embellish this with something else as time goes by. So when awareness is stuck in algorithms, you think a cup of tea is just a cup of tea based on ingredients. One of my friends who talks very eloquently on leadership based on a cup of tea says to me, the thing is, what is inside that bag is more important than what the bag is all about. I say, yeah, that I understand. It's a very blunt metaphor. Can you go further? Then he says, unless the bag is in hot water, the best stuff doesn't come out. I said, that is also true, but that's still not very sophisticated. He says, somebody else is pulling the strings and you are not. So you're not in control. I said, yeah, I understand that. He says, sometimes you need 2 bags to support. You need a vice president as well as a president. And so you need 2 bags to do the work. And then he says, the bag can come from any side, which is what leadership is all about. But the most important part is the bag must know when to leave. I said, that's a very formidable description of leadership, but let me count on my imagination to give you my understanding of a cup of tea. I said, what you see as a cup of tea, literally, is photons of light falling on a green leaf, turning it brown. What you're drinking is basically photons of light, but you can't drink light directly, so you heat it up and you put some water, and the concoction is a very attractive brown beverage. You're not happy with that, so you have a dash of white fluid, which a black cow eating green grass will produce. And so you realize that little concoction makes the tastes different. But you're not happy with that, so you take the sap of the earth through a pump called sugar cane, and you crystallize that sap, and you call this sugar cubes, and you stir it. When you're stirring that inside your cup of tea, what you're getting is cosmic conspiracy. in a cup. Air, water, fire, earth, the entire cosmos has come together in a certain proportion to give you that joy of life. It's the Panchabhutas, as the Indian seers would say, in a cup of tea. And so when my friend hears about this metaphor, he says, from where do you get this idea? I said, see, just my imagination gets tickled, and when we are in conversation, some best stuff comes out. That's part of my education in India, in spite of which I am wherever I am. I have been to a school where, in my little town in Bengal, where we had educational ATMs like automatic teaching machines. These are called professors and teachers, and they would come to class, blare out whatever they had to, and then the real action was outside the class. And so you saw life was so hectic. When you moved in Calcutta, in those days when I grew up in Calcutta, typically in civilized cities, you drive on the left, but in Calcutta you used to drive on whatever was left. So our ability to deal with the other world had gotten honed outside the classroom. So classroom was a necessary cooling period where you learned your lessons, and in the classroom you rested when teachers taught and you slept, or you imagined another world. And I think it was a great escape from wrong teaching. And so all I could tell you that India grows both in spite of its education and because of it, because I think I'm forever indebted to some of my great teachers who has brought me face to face with reality that I would have never understood if I went to a public school in India or a private school in the United States. And so all I can tell you is that when awareness is not stuck in an algorithm, what happens is that you begin to see dimensions of learning wherever you watch and you observe. This flow of curiosity is what was the greatest thing. In India, in our times, every day was different. Every season was different. And so what gave us was this dimension. So if you were driving in a car in Calcutta and a black cat happened to cross your street, immediately the car would stop. And you ask the driver, why have you stopped? He says, a black cat has crossed the street. I said, why would you stop there? That's a bad omen. Something bad is going to happen. I said, okay, so how long will you stop? He says, until the next guy goes through. I said, for him, the omen does not work. He says, no, he's not aware. So I said, that's an interesting phenomenon. So I realized that there's another world of beliefs, superstitions we have to negotiate. And then I'm in Harvard Kennedy School of Government, and I happen to go to the business school where I meet one of my old friends, and there's a reunion going on. A little girl asked me a question. Interestingly, what does a black cat crossing an Indian street on a new moon night mean in India? Now, you're obviously tempted to defend your superstition, but I say it simply tells me that the cat is going somewhere. That's about it. So you can see that I have had access to the world of imagination, to the world of the esoteric, and the world of the rational. And I think that fine balance was very critical. And I think going forward, education, as I see it, is going to be restoring that lost balance. It's not so much about algorithm. So what we have to do going forward, and I think the educational process will have to look at the guru again. Guru not as a person, but guru as a process. And I'm telling you this, they're two different things. What you see as a guru is essentially a distortion of a very extraordinary process that Indian masters had actually conceptualized. And if you look at what the word guru means, it has three cognate meanings. It means eternal traveler. It means dispeller of darkness, which means moving from darkness to light. And it means seer of the whole. These are three meanings of the word guru. And if you look at what that movement from darkness to light represents, it's awakening of a dimension of the human personality which gets submerged in the process of our education. See, we are educating the mind, we are educating the body, but I mean, an education that does not build on reflection as a critical value, as action is. Mind is a very active element. And the mind is incapable of reflecting on itself unless it accesses another dimension. Therefore, reflection becomes a natural corollary of action. When action goes beyond the capability of reflection, when the world of algorithms and machines and artificial intelligence overreach the dimension of the human being, we need to bring back the guru. And the word guru, for me, stands as that reflective capacity that balances the active world. The Indian model of a leader was Rajarshi, Raja and Rishi. Raja was the executive, the active. Rishi was the reflective. Without a Rishi, there is no Raja. Without an Aristotle, there is no Alexander. Without a Krishna, there is no Arjuna. Without Chanakya, there is no Chandragupta. So if you look at the aspect of technology that has taken over not just our physical prowess, but also extended our mental capacity. The definition of a machine today is not that which extends a human capability, physical capability. A machine today is what extends our cognitive capability to a point that it is replicating, mimicking our emotions. It is actually taking over a large part of the human cognitive apparatus. Therefore, what is left of us is to reflect, to be able to conjure up that evolutionary stuff in us. This is what why the human species has been what it is. It can reflect on its actions and it can change the course of actions. That capacity is the capacity to get unstuck. So if I look at this metaphor of an elephant in Kerala, the state I am in, you know what they do, and it's done in most parts of the world. When the elephant is very young, the elephant is tied to a tree with a chain. And the small elephant struggles to get out but can't get out. And eventually what the elephant does is it gives up hope. And it realizes that the limits of its possibility of movement is the limits of whatever it thinks it is. And as the elephant grows up, the elephant carries with him that mindset of the past. And a grown elephant just needs to be tied with a small thread or even a rope and doesn't even want to get away because his childhood memory of getting stuck is still with him. And this is what the future of education is all about. It is held hostage. It's a hostage situation there by a mental models of the past that have refused to go. And the velocity of change towards the future can only be achieved by decoding the anatomy of what you might call the resistance of the past. And it is possible that if you look at the resistance of the past, which is holding back the future is not, as Toffler said, the future is not something sitting there like a duck. It is already happened, except that it is unevenly distributed. The fact is, the thing that does not allow us to negotiate, to come face to face with the future, is that the resistance that we face from the models of education that have already been there. So our great teachers will have to be active unlearners, which they have not been trained to do. And so this is the real challenge of the future of education. How do you take this massive unlearning project across the world? And I think in IITs, IIMs, we are faced with this huge amount of irrelevance and obsolescence because we have learned something the wrong way for a long time. And it is very, very difficult to unlearn it. And I remember at the end of it, this is what I want to share with you. Maybe I have another point to make, but I had a conversation with D. Hawk in Cali, the man who created what you know today as Visa. So I had this conversation with him, wonderful conversation about how we invented it. He said, Visa, and he said, I just redefined money. I said, how do you redefine money? He said, I define money as human energy impulse that could be alphanumerically coded on a plastic card, and those impulses could be transmitted from one continent to another, provided there were two things behind the transmission process. One is value, the other is trust. I said, this is such a great idea, but how do you collapse this idea into something that can be executed? He said, that's why I gave you a business card-like thing, like a Visa card. I said, but then how do you negotiate your new idea and your execution with 100-odd banks that had to accept Visa as a concept before your Visa thing? He said, I had a mantra. I said, mantra is an Indian word. What does the word mantra mean to you? He said, anything that works is mantra. I said, you tell me what is your mantra. He said, anytime I met a person who's superior to me in rank, hierarchy, or talent, my mantra for him or her would be, you are as great to me as I am to myself, therefore we are equal. And then his mantra for the person who's below him was, you are as great to yourself as I am to myself, therefore we are equal. I said, did that always help? He said, no, but it never failed to work. Because what happened is, my communication was based on truth. It was not based on a condescending position or something that I was, So it was not about inferiority spirit, it was about equality of being human. And I took away something very significant from there. I said, here is D Hawk. He's talking about the Indian Namaste. So I told him, since it was only a telephone appointment, I said, I'm folding my hands. You please, you want to understand what Namaste is. That's your national greeting. I said, it's more than that. So you have to understand this again. So he said, what do I do? I said, you fold your hands, fingers pointing up, the thumbs pointing towards the heart. And you say to yourself, with all the power of execution in my hand, with my cognitive capacity in my head, going down towards the hand, connecting the hand and the head, and with my heart in the whole gesture, I acknowledge the divine that resides in equal measure in you as well as in me. He said he was quiet for some time. And then I said, if I've gone a little overboard with my explanation, replace the word divine with visa power, the formula remains the same. When your cognitive, your emotional and your physical capacities work in tandem to pursue that ultimate expression of you in the form of the divine, you get great stuff, including visa, right? And so I did not know how to explain it away. But then I would like to finish with the 3 research questions that I have been asking a lot of people. My own teachers have been asking this question. There are 3 questions that are necessary for me to ask to understand what the future looks like. The first question is, in order to excel in your work, what are the 3 top capabilities you need? I'm asking several people, youngsters included. The second question is, what are the qualities of the teacher that influence you the most in life? And the third question is, if today was the last day in your life, thanks to COVID-19, what would you most regret not learning? And you know what the answers to these questions were? They're nothing to do or little to do with knowledge per se. They're little to do with what is being taught in the universities per se, schools per se. They're everything to do with those non-cognitive aspects of life, namely clarity, compassionate behavior, ability to connect. Those teachers who were revered by students are the ones who share their lives, their being with them. So I have a sense that this is the time to recover the lightness of being. Not being this, not being that, not being the other, but just being by itself. The Rishi said was the fundamental core of all that there is. And finally, I would like to say that these 3 elements of clarity, compassion, and commitment would be the defining values of education in the future. Clarity because there is too much knowledge and too little understanding. Compassion because the heart has become so egocentric, inward-looking. And commitment to excellence because we have gotten lost in expertise, which is not the same thing as excellence. Expertise is about knowing more of the same, being more efficient. Excellence is about being more evolved. I'll give you a last example, then I'll quit here because I'm really, before I go to sleep, I want to listen to Vivek now. He has lots of great things to say. I want to learn from him. But the fact is, the last part that I want to share with you is a vision from a little boy who's shining shoes in Ahmedabad railway station. You see him polishing shoes, but he's carrying an English edition of the Times of India. And you wonder if he can read and write English, or at least read English, why should he be polishing shoes? Because in the pecking order, if you read English in India, you shouldn't be polishing shoes. That's the caste system of the academic world, right? You should be doing something more sophisticated. So you walk up to him after he polishes the shoes of the gentleman he was polishing. He said, do you read English? You ask him. He said, no, I can't read. Why are you carrying an English newspaper in your hand? He said, the man whose shoe I'm polishing, he gets bored sometimes. And they like to read English newspaper. So hand it over to him while I polish his shoes. This is excellence. This is expertise going beyond its own obsession to see how expertise can be of service to somebody else. And you learn it from every human entity, not just from universities. I rest my case. Vivek, you can take over.
Thank you very much, Professor Chatterjee. I really enjoyed that. And I couldn't agree with you more about the non-cognitive aspects of learning and how important those are. So I think that we'll take questions at the end of the session. So if anybody has questions for either of our speakers, please put them in the chat box. All right, well, moving forward, I am going to introduce our next speaker, Professor Vivek Wadhwa. He's a distinguished fellow at Harvard Law School's Labor and Work-Life program, and he researches the impact of technology on employment. He has held appointments at Carnegie Mellon, Duke University, Stanford Law, Emory University, and Singularity University. He's the author of 5 best-selling books and has been a globally syndicated columnist for the Washington Post. Professor Wadhwa is based in Silicon Valley, and he researches advances are in areas such as robotics, artificial intelligence, computing, printing, etc. In 2018, he was awarded the Silicon Valley Forum's Visionary Award and joins a list of luminaries who have made Silicon Valley synonymous with creativity and life-changing advancements in technology. He's been featured in many magazines and publications and has appeared on multiple national and international TV stations. And I'm very much looking forward to his talk today, which is going to focus on how advancing technologies are making a Sir Wadhwa.
Thank you. I'm really looking forward to reading Professor Chatterjee's book as well. It sounds really, really fascinating. What I'm going to do is I'm going to give you, I'm a technologist. As a matter of background, I've been researching everything from AI to sensors to quantum computing, all of these advances. Ayurveda is not my field. In fact, I don't practice Ayurveda. But I'm going to take you from my perspective to why I'm interested in Ayurveda. Why am I, part of this conversation over here? I'm going to walk you through advancing technologies and what they're making possible. So let me see if I can successfully share my screen. Application window. All right, let's see if we can make this technology work. All right, I'm going to walk you through what's happening with technology and tell you why I think that science is coming full circle. First of all, this chart over here shows you the history of technology. It took thousands of years to go from agriculture to pottery to the peak of Greece and Rome and so on. Over the last 100 years, we've had advance after advance after advance. So much that we don't seem to comprehend how these technologies are advancing. This device over here in my hands is a smartphone. It has more computing power than the Cray supercomputers of yesteryear. Cray supercomputers that could not be imported into India or many other countries. This is something like 50 times more powerful than those Cray supercomputers. And the poorest of the poor now have these devices. This is how technology is advancing. What's more, it's not just computing. It is everything that computing touches, everything from AI, robotics, network sensors, virtual reality, synthetic biology, genomics. All of these are advancing exponentially, as is medicine. The coronavirus, when we first had this outbreak, people were talking about vaccines. It'll take decades to get them. Why? Because it took decades in the past. The same thing with education. You say you had the same logic being applied to medicine. Yet in the next 2 or 3 weeks, we'll probably have an FDA-approved vaccine. And it was all based on genetics, based on the data that they gathered. This is how technology is advancing. And by the way, the same technologies that have been used for creating the RNA-based viruses are going to be able to cure disease, as I'm going to talk about. So now if you go to an Apple store, Apple is in the business of selling medical devices. It's become a medical company. I mean, who would have ever imagined that a tech company would be entering medicine? But this is what's happened. It's all become about gathering data, medical data in this case. Next step, we won't have iPhone cases that monitor us. We'll have sensors on our bodies, literally tattoos that monitor our health 24/7. And then we're going to be connected online 24/7. And then we're going to be going inside the body. Literally pills that we take that can monitor our body, that can navigate different parts of it and gathering more data. That's the name of the game. Data, 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 data. And what do you do with data? You use AI to analyze it. What's AI? We keep hearing about AI. Let me simplify it for all of you because the tech geeks try to make it look like magic. There's nothing magic about AI. AI is pattern recognition. You give it lots of data and you give it a model for what you think it is, and then it analyzes that information and says, okay, here's what you have. You tell a system what a duck looks like and what a dog looks like, and you give it examples and says, oh, okay, this is a duck, this is a dog. That's what AI is. So with the types of data we're gathering in medicine right now, soon AI will exceed the capabilities of our doctors. I'm not kidding. In the next 5 years or so, we will have enough data that you will be able to have a software system analyze the information better than a doctor can. Because what does a doctor do? A doctor looks at your symptoms. A doctor looks at your physical attributes. And this applies to Ayurveda also, by the way, because what are you doing? You're looking at data, except it happens to be interpreted differently, but you're looking at data and you're analyzing it. Soon, AI will be able to do that magic better than human beings can. Then what is disease? We have symptoms. We have cough, fever, abdominal pain, etc., etc., etc. This is what you folks have been analyzing. What's disease caused by? Genes and proteins. And the problem with allopathy, with Western medicine, is that it treats the symptoms rather than the person. And this is what the big flaw in Western medicine is, that you're always treating symptoms, rather than realizing that we have a whole, and it's a very sophisticated whole, and parts of that whole you have to come together to be able to treat the person. This is the difference between Eastern medicine and Western medicine, but it all comes down to the same thing, that you're looking at data. And if you look at all of the data that you have on disease, how many types of diseases do you have? You have a finite number of symptoms. I mean, you're going to have a pain in the butt, you're going to have a pain in the arms, you're going to have a pain in the head. How many different types of pain can you have? It's finite. There are a finite number of connections between symptoms and diseases. There are also a finite number of diseases. There are roughly 5,000 or 6,000 diseases by some counts, if you look at the medical journals. So understanding and curing disease is a data problem. And who does analysis better than anyone else does? A system called AI, software, data analytics can analyze this information better than you can. And I'm applying this to Ayurveda as well, because ultimately it is all about analyzing information. And when you train an AI up, when you take these supercomputers I talked about and the data storage capabilities they have and put all these pieces together, suddenly you can do all sorts of amazing things with technology. So soon you will have AI doing analytics of health. And then there's the human genome. In the year 2000, there was a race between a scientist, Craig Venter, and the US government and affiliated labs to sequence the human genome. The scientist won. The entire effort cost about $3 billion. Today, in China, you can get a full human genome sequence for $600. Next 3 to 5 years, it will be as expensive as a blood test to get a complete human genome sequence. It'll be practically free. It means that we become data and our doctors are becoming software. This is how technology is advancing. In allopathy, in Western medicine, the focus is on precision medicine, on taking genetic information and trying to come up with treatments and cures for it. But I'm not going to get into this presentation. I can give a separate talk about this. The entire basis of this is flawed. That it's not just genetics that defines us. It's much, much more complex. And this is what you folks have been researching. Because here's what's happening. The same technologies that have been used to sequence the genome have been used to sequence the bacteria in our gut. And there are all sorts of amazing, incredible advances in science happening because of this. In the talks I just heard in this event, I haven't heard you folks talking about the microbiome. I mean, maybe I talked about it, but I didn't hear it. The fact is, this is what you should be looking at, because you'll find that Western medicine is coming full circle, because what they're discovering is that the microbiome seems to be regulating our health. Several studies in Science and Nature and all the top publications, we looked at obesity. They took the feces from a fat mouse and gave it to a thin mouse, and the thin mouse gained weight. They took the feces from a thin mouse and gave it to a fat mouse, and the fat mouse gained weight. This doesn't make sense according to Western science, because the way you lose weight is by going on a diet and eating more carbs or less carbs or more protein. I mean, all these bizarro diets that they have, trying to cure health by eating more or less food, when it seems that it's the bacteria in your gut that regulates your weight. The Chinese did this on humans, and they were able to replicate the results. So imagine now losing weight by eating feces. Many of us would go to that extent, but there are better ways, as you know. And then Crohn's disease, a debilitating disease that children have. Again, fecal microbiota transplantation showed that you could remove 100% of the symptoms of the disease by transplanting fecus. Doesn't make sense in Western medicine. And then cancer. There are several studies that have been published which show that the genes and the microbes influence each other. And the treatment for cancer may actually come from the microbiota. You know, if you want, you know, there were several discussions here, like what Dr. Frawley was saying about data and science. Well, go and read some of the studies on the microbiome. There's solid evidence now that the bacteria in the gut influence your genes. In fact, it seems that they're turning on and off the genes that cause cancer. So there is substantial scientific evidence showing that the microbiome may be causing or maybe the cure, the key to curing disease. Look into this field and you'll begin to find all sorts of incredible science being developed over here. And then it also seems that the microbiome affects the efficacy of drugs. So that you may be taking specific allopathic medicines, but it's your microbiome that dictates whether those drugs work or not. So what I surmise from this is that both of these systems can actually come together, that you may be able to take some drugs to target specific disease and then enhance the microbiome to make the drugs more effective. Because if you're targeting particular symptoms, I mean, if you have cancer, all the Ayurveda in the world is not going to save you, because that cancer is going to eat you up before you have a chance to reprogram the gut. So therefore, you're going to need the advances in Western medicine and to have the Ayurvedic treatments enhance the efficacy of those treatments. It's going to be a combination of things which are the key to our future. And again, this is what Ayurveda is all about. This is what you folks have been talking about, that it's all about the bacteria in the gut. But what you're going to now find is that if you keep looking at where the microbiome is taking us, it is like termite eating the foundation of a house. And that house is Western medicine, that the entire house is about to collapse because its foundation is being eaten away by the same science that it has been using to develop treatments with. Because if you understand it now, if you see how everything coming full circle, the microbiome seems to be the key to our health. And there are several studies, again, in very prestigious scientific journals, which show that the secret of longevity is in the microbiome and in the gut. So, you folks have been talking about needing more research in Ayurveda. The research is there, except you're not looking in the right places. Look into the microbiome and set up the platforms for analyzing the gut and the results of it, and you'll find that incredible things are indeed happening. I have a book that you folks should read, the Indian version of it, not the US version. The Indian version of it, it's called Driving the Driverless Car. I have a chapter in there about curing cancer, and I also talk about Ayurveda in it. This book talks about all of the key advances happening in medicine and how we're coming full circle on many of these things. It talks about the choices we must make to build an amazing future. And the book is Driving the Driverless Car. The Indian version, you can get on Kindle for $4 or $5. It's really cheap. You should all read that book because it'll give you many insights. The next book which just came out is more about the business aspects of it. It's less relevant to this discussion. The Driving the Driverless Car is a book you must read. With that, I'll hand it back to Diane, and we should talk about what all of these things mean. One second, let me see if I can get my screens back. All right, Dan, handing it back to you.
Okay, thank you very much. That was a really interesting talk. And I have to say, it really resonated with me because as a neuroscientist, when I was studying Ayurveda about 13 or 14 years ago, the message that I got, or the sort of take-home concepts as a scientist, were the concept of the importance of digestion and elimination, obviously in Ayurveda, and also the concept of inflammation. And it's been absolutely fascinating in the last 13 or 14 years to see Western medicine come up with those same concepts, the whole concept of the microbiome and its importance, and then the concept of inflammation, and how even now we're looking at adipose tissue as not just a passive organ or a passive tissue, but as an organ that can regulate inflammation in the body. So it's very, very interesting to see your perspective as well.
See, I'm coming from a technologist, and I know, again, knowing nothing about Ayurveda. And suddenly what I'm seeing is that, oh my God, this is all coming back to the ancient wisdom of Indian medicine. It's all coming back to the gut and they call it the microbiome, but it's really essentially the same science. And here is all the scientific, because, in the conversations you've had in this conference, everyone's been talking about, we don't have enough research, we don't have enough research. The research is there. Open your eyes, read the scientific journals, do a Google alert on the word microbiome, and you'll find research studies every day. Literally every day, you'll get a new alert, which shows you more advanced, more incredible discoveries have been made. And microbiome to me means Ayurveda, because you're the ones who understand how to, fix the microbiome. You got the solution to this all.
Yeah, it's fair. I mean, I could go on forever, and I won't, but I will just enforce that, there is a lot of biomedical research out there that supports Ayurveda, whether it's the microbiome, circadian rhythms. There is a lot of science out there that supports the concepts in Ayurveda. So I do have one question. Let me see. I'm looking in my chat box here. And I have a question that is addressed to both of you. So I'll read it out loud, and perhaps Professor Chatterjee can go first. And the question is, what lessons can we learn from the great institutions of the yonder era, Taxila and Nalanda, and implement in today's and future educational systems? And she would like both of you to address that.
Okay, so do you want me to go first?
Yeah, why don't you go first?
I can make an attempt. So look at 7th century Nalanda and Taxila. They were attractors for a large number of people from all over the world. The core foundation of these two universities, where they were disseminating the knowledge of awareness. Vivek just made a mention of Ayurveda. If you look at Ayurveda, they did not go through the analytical route to start with. They looked at the intuitive, ecological. If you studied Ayurveda, you had to study astronomy. You had to study the other sciences that were allied together. So Ayurveda became a little aspect of the larger dimension. So you couldn't just study Ayurveda as a standalone discipline in a silo. Nalanda, Taxila were repositories of knowledge that were unitive in nature. They were not the kind of universities that we have today. And the reason they were attractive to people who came from all over, interestingly, the gentleman who actually chronicled his experience of Nalanda was a Chinese. For lack of my Chinese knowledge of Chinese, Mandarin, I can say his name is pronounced as Yuan Sang in India. And so he wrote those chronicles, and this became one of the best-selling work in China, and it was called Journey to the West. India was literally considered the West as far as China was concerned. And there was a swing door between India and China. So the Chinese came to India. They understood that this thing that the Indians had perfected, which is to look at the transcendental, look at the big picture. And then you can narrow down into specifics of the human gut. But the human gut stands in relationship to something much bigger than the gut. And so this whole ability to not just analyze knowledge, but synthesize it around those transcendental values was the genius of India. And I think if you look at anything, if you look at all the great works of literature, of medicine, there is always an Indian voice in it. And if you look at the Arabian Nights, it was an Indian text. If you look at Aesop's fables, and then you look at Panchatantra of India, which preceded the fables. And so all of a sudden you realize that all that India did was fundamentally look at every dimension of human life in relationship with the larger cosmic reality. Had to be understood first the relational world, and then the analytical world would follow. People were great analysts in India too, but it was not the other way around. And that became an attractor for a lot of people, because the Indians had that magical ability to crisscross many frontiers And very interesting story, you know, that is why probably foreigners got attracted to India. Alexander is camping near the border of India. He's about to conquer India, and he sees a man half naked sitting near where Taxila would be, close to Pakistan. And he doesn't move the whole day. So Alexander is a little wonderstruck. He says, gentlemen, tell me, do you have any business in life? Do you have anything to do? You're sitting there day in and day out, evening, morning, afternoon, generally doing nothing. So tell me, what is your goal in life? So he doesn't respond. And Alexander says, do you know who I am? Do you know what I can do to you if you don't respond to my question? After a lot of cajoling and coaxing, and Alexander almost is on his knees, and he says, great Alexander, first tell me who you are and what you want to do before I tell you who I am. So Alexander says, you don't know, I've conquered half the world. Then what will you do? I'll conquer the rest of it. Then what will you do? I'll have all the elephants, then all the horses. And then what will you do? Well, I'll have all the men as my slaves and women as my concubines. And then what will happen? He says, then I'll sit and see and reflect on what I have done. And the man says, this is precisely what I'm doing. Why are you bothering me? Go ahead and do your conquest. So the Indian route to the gut was through something much bigger. And they had an intuitive grasp of things, which is the province of human capability. We have lost that completely. And so I have a huge difference with Vivek, although I respectfully, watch his analytical ability to, but then the Indian approach to education, to life, to marriage was always cosmocentric. It was not egocentric. It was not analysis-based. And therefore, India still persists, believe me or not, it still persists. India lives in multiple time frames. There is Ayurveda in Kerala. I go there for attending to my gut. And they indeed say, and Vivek is right, they indeed say the gut is the very source of everything. In fact, they were giving me a treatment for the gut, for every other thing that happened to the body. And there's absolutely clear evidence that the gut is but gut is not just a gut as an anatomical organ separated from the rest of the body of the universe. Gut is a relationship with something else. And so to the weather, to the way, you have to eat specific food in specific times of the year. You're not supposed to eat mangoes in winter. You're not supposed to eat, cold food in some. And so there are lots of stuff. And then you see references. So I'm sorry to wind up this, to create a long winding story, but the fundamental attraction for Nalanda and Taxila was the very ability to synthesize multiple strands of knowledge and have the wisdom to explain it. And I think that caught the attention of a lot of people. And there was a rigor, you could donate to Nalanda, but you couldn't run the institution. It had to be run by masters. They had very rigorous admissions criteria, incredible discipline. You have to get up at the time. If you did not follow the discipline, you were not there. And so you see all of the stuff that constitutes a great university. We had the makings of all of that. The word university meant that which is universal. University doesn't mean that you become parochial. And that is what university meant in India. And this is what it's supposed to mean today. But it doesn't, unfortunately. I rest my case. Sorry for the long answer.
No, that was great.
Professor Chatterjee, I need to correct something over there, okay? You said I disagreed with you. Actually, I don't disagree with you. In Driving the Driverless Car, I have an entire chapter on the future of education. In it, I talked about the technology advances that are going to make amazing things possible. And those technologies are advancing. The fact is that you have many companies now in India which are developing online education. What I said was that there are two aspects of education. One is the knowledge transfer, which is what's happening. So when you have BU and all of these online learning companies, and the poorest of the poor now have internet access in India, because thanks to Mukesh Ambani and his evil empire, he's actually doing a lot of good for India by providing internet connectivity. So they're getting access to it, and they can get the knowledge transfer through that. But the most important part of education, as I described, is the character building. The guru and the shikshat. I mean, basically, the student learning from the values and the ethics and the morals, the same things you talked about. For that, you still need the human being. So, even the knowledge transfer will be done through virtual reality, AI, all of these digital tutors and these technologies. The character building, the value system, the most important part of the learning will still be done through the guru, through the human being. And that's what so I actually agree with you in what you've been saying.
Well, thank you. Appreciate that. So over to you. Dr. Lowry.
Okay, sorry. Can you hear me? I'm having a little bit of network issues here.
We can hear you. No problem.
Whoop. Can you hear?
Yes, we can hear you clearly. We can't see you though.
Okay, can you see me now?
No, not yet. We can hear you.
Maybe better leaving your camera off for bandwidth.
Okay.
I can see you.
Okay, well, I'll just go ahead and okay. So I had some questions, and I thought we could maybe talk about this a little bit, and I will direct my first one to Professor Wadhwa, and that was, I was very interested in what you said about AI and data, and how our symptoms and our data will have an AI machine to determine what our disease is. And I am curious how you would reconcile that with some of the symptoms that we're getting with COVID-19, because they are not unique symptoms. Maybe AI can interpret the order in which they happen, but how would you kind of reconcile that with a very general symptomology?
See, yeah, so far we have not had the data to understand exactly what COVID is. That's what we were guessing, what causes it, and so on and so on. This is the problem with the Western system, that data is not shared. So to solve COVID, what we need right now is crowdsourcing of massive amounts of data. Exactly what are the symptoms? What happened in the hospitals? What medicines were given? What were the side effects of it? And what did it cause? What's the genetic sequence of the person who had this? What's the genetic sequence of the virus? I'm not talking about small amounts of data. I'm talking about massive amounts of data. Massive amounts of data on a scale that humans can't understand it. Because with AI, there's no limit to how much you can analyze. With the super fast computers, you can do so much with it. The key here is to gather the data. If we have time later on, I can tell you about a proposal I made to Narendra Modi and the Dalai Lama about curing cancer itself. I made a proposal to them, and Kanchan did share that the document if to whoever wants it. He has a copy of it. I presented a grand plan to cure cancer. And I said, India has a unique opportunity here because India has the data, and it doesn't have the pharma companies that are trying to hoard the data. It doesn't have a medical system that's so corrupt that you can't change it, that it doesn't want to change. Right now, it has nothing to lose, so that it can gather the data necessary to cure cancer itself. That detailed proposal explains all of the aspects of it. And the Indian version of driving the driverless car also, I published the entire grand plan in that book, so you can understand what I'm talking about. It explains how data can be used to cure disease.
Okay, I'm sorry I had to come back and reconnect.
Right.
So I missed some of your answer. Question that's come up, and that is, are there going to be brick and mortar classrooms in the next decades? And I'll direct this first to Professor Chatterjee, and then Dr. Wadhwa, if you'd like to chime in.
Why would they not be there? I could ask a counter question. Brick and mortar is not going to go away. Just as books haven't gone away because digital learning is. They're going to stay because there are multiple modes of. See, there are a lot of things that happen under a tree better than happens on the internet, because there are methods and modes of learning that require a certain degree of repose, that doesn't require exposure to the entire world. It requires a deep conversation between two people. The Upanishads translates as you sitting at the feet of the master, and that's exactly how to sit becomes the very basis of education, how to sit properly. And if you do not know how to sit, your mind moves around everywhere in the world and you don't know how to sit. That's sure evidence that your mind is not in the right place. So the reference to brick and mortar is a reference to that. I can't throw away everything in the past. Bertrand Russell said something very interesting. He said, men of the past were parochial in space. They were thinking north is not good, south is, but men of our times are parochial both in space and time. They think everything of the past must be outdated and bad. everything of the future must be modern and new and convenient. That's not true. And so echoing Russell's words, I would simply say that we have to restore to our education system something of the past that is utterly relevant, absolutely contemporary, and you cannot but bring it back. At the same time, I can't ignore the fact that digitally I can, share notes with Diana Lurie or Vivek Vada or Kanchan or Dr. Purnima seamlessly. This continues to amaze me how I can do that, but it doesn't take away from the fact that every day I sit down quietly for 20, 30 minutes before I begin that day. And I say, may the best happen to me today. I say a quiet prayer, and I don't think there is such a bad idea, given the times we are in. And so the point I'm trying to answer the question, will brick and mortar stay? Well, yes, they will stay. But they will stay in a context, for a purpose, for a reason for which they were created in the first place. And will click and move also stay? Well, they will stay for the specific purpose for which they were created. There were two purposive dimensions, and that's what matters the most.
I completely agree with that. The rote and memorization will change. Really, the role of our institutions will be to do the character development and teach us the basics versus the knowledge transfer, which can always be done online.
Yes, I agree. I see in our pharmacy school, our students come in and they are not dressed appropriately and they don't have social skill as well-created social skills, counseling skills. And 4 years later, when they graduate, they're almost different people. And it's not just based on the knowledge that they have, but it's based on a maturation process. It's based on a professionalism, a journey down the route of professionalism. And so for me, what COVID-19 has actually shown is that, yes, our technology is good. We can do remote learning, but it is those human interactions and those nonverbal cues that are really very important for the
guru
students.
becomes only more important, not less important.
And
yeah,
by the way, the word profession, you just made a reference to professionalism. The word profession comes from a German word called Beruf. It means spiritual calling. So the word profession actually meant your calling as a guru. And so professional has come to mean something very different today. Exactly the opposite. I mean, it is the anti-guru.
Yeah.
The more of a charlatan you are, the more of a sort of, you can hoodwink a lot of people, you're considered a professional. But it is a completely different turn from the original etymological root of the word. So I'll point this out to you.
Yeah,
well,
no, that's very interesting. It is interesting to see how things change.
Right.
Yeah.
Right.
So there's another question. Oh, sorry. Is there another comment? In order to go back to the Upanishadic model of learning and teaching, where do we start in modern times? And I'll let either of the panelists take that.
Professor Chatterjee, I think you should answer this.
Well, I have to get the question right. Can you read that question once more? I haven't got the question right. Where is that question?
Oh, sorry.
I can't see.
In order to go back to the Upanishadic model of learning and teaching, and I hope I've pronounced that correctly, where do we start in modern times?
Well,
so where do we start? Yeah.
Okay. See, we start with the basic assumption that I don't know. I realize that people come to class all full of themselves with the chip on their shoulders. I know I'm restless. I still remember I used to go and teach an occasional class at the Harvard Business School from the Kennedy School, and I see a boy standing, a mid-career student of business school, standing for a bus, and he knows precisely the bus is going to come at a specific time, and he's looking at his watch. 15 seconds away, 15 times he looks at his watch. And when I meet him, I said, why are you looking at your watch so often? You know the bus is going to come out. He said, I was just bored being there with myself. And I said, if you don't have an appointment with yourself at peace for 15 seconds, it begs the question, what kind of a person have you become? And so where does it start? It starts with a basic assumption that there are lots of things I don't know. The humility that constitutes the very basis of the Upanishad learning has not lost relevance. In India, the expression is Vidya Dadati Vinayam. It means, translates as, knowledge gives you humility, not arrogance, not a sense of entitlement. And so that is the fundamental beginning of learning. And the word humility comes from the Latin word humus, which means soil. So unless the soil is ready, the tree cannot take shape. So unless you start with that, Vivek was making a reference to character building. This is the primary driver of excellence, of knowledge. And this is missing completely from the more. So if you have to start somewhere, I would say that first have a class on what it means to be humble, to be receptive, how to listen without your prejudices coming up, how to approach knowledge with a sense of reverence. And I think the moment institutions lose their reverence for knowledge, it loses its credibility, its validity in the world. If they become trade schools, and this is what institutions have become, they have become vendors of how to trade in the world, and that's where the reverence is lost. And I think to bring back that reverence is going to be the effort of a lifetime for many institutions going forward. But unless that is brought back, I personally feel that it will be a false start that we have in modern institutions. So Upanishads can come back not in form, not in ritual, but in spirit, because they're talking about the fundamental values of what it means to learn. That's all I have to say.
Oh, thank you. Thank you. Yes, I absolutely agree with that. So there is another question, and this is for Professor Vardhan. Are the robots going to rule us in the near future?
The robots already rule us. I mean, we have dishwashers, we have vacuum cleaners. Robots are technology. They're going to get more and more sophisticated, and they'll start doing more of the work that human beings do. And then eventually they're going to start, you're going to have, robotic cars that drive themselves. My Tesla, when I get on the route, I'm in Silicon Valley, when I get on Route 280, which is the main, highway, I just put it into autopilot, it drives itself. So it rules the road at that stage. Soon they're going to start doing all of the driving, and, clerks and, accountants, a lot of these jobs are going to be threatened by it. But that's still, a decade or two away in the West, and 3 or 4 decades away in India. So I wouldn't worry about it right now. Right now, let's just learn how to uplift ourselves and to take advantage of technology to cure some of the basic problems of humanity.
So could I ask a follow-up to that? So what do we do with my original example of we have a vaccine for COVID, we've developed it, and how do we get that technology out? And how do we deal with people that don't believe in science, that don't believe in vaccines, that feel it's a conspiracy or that it's not real? So how do you merge that technology with some of our human psychology?
Well, when it comes to COVID, I don't think everyone has to worry, because the majority of the population will not die from it. There's a small minority that will, and we know what the markers are for them, the elderly, the obese, we should give those people a choice, saying, look, if you want to live, or if you want to not be completely, devastated by it, then take the vaccine. The rest of the people really have to have a choice, because vaccines that historically have had negative effects as well as doing a lot of good. But the good thing about this new generation of vaccines is that it's not like the old vaccines. We're not now taking dead cells and putting them into the body the way we did before. We're essentially taking the essence of it and injecting it. So there are a lot of issues about what's good and what's bad over here. But ultimately, this is something we're going to have to figure out in the next 12 months or so. And I think that we will figure it out, and the majority of people will take it. And this will, this pandemic will be over, and we'll be worried about the next pandemics soon, in the next 3 or 4 years. I wrote a piece in Foreign Policy magazine about what I just said, by the way, about the next pandemics, because I believe this can be bioengineered, and I'm really worried about it. And this is what I wrote a couple of articles for the Hindustan Times also about why India needs to develop its biodefenses. Because just like we can cure disease, we can create new diseases now with the same technologies, with CRISPR and with genetic engineering technologies. We can actually create new types of problems. So there's a lot happening at the same time, and good and bad, good and evil at the same time.
Hey, Doug, are you on the internet at all? Because I keep getting bounced off of it. Okay, well, thank you. I'm sorry, I'm having some internet issues here.
There's a difference between the East and the West. Right now, they have better connectivity in India than you have in Boston. I mean, which is,
well, I'm actually in Montana, so I'm up in the mountains right now, and my internet's coming through the phone line, and it seems to be very fluctuating right now, of course, when I need it.
But what my friends in India don't realize is that they have better connectivity than we have here in Silicon Valley, and they think they're there's something about India. That everything that India does is less. We're poor. We don't have. No, you actually have better connectivity in India now than you have here in Silicon Valley.
Yeah.
Yeah, we are the youngest old country in the world, youngest and the oldest in the world at the same time. And I'm already ahead. I'm closer to Monday than you are, and so you can say I'm rushing ahead in time as well. so unless there are other questions,
I think that we are at the end of our time for our panel. I'd like to thank both of our panelists for a very lively discussion. I enjoyed it immensely, and I will now, so thank you very, very much, and I will turn this back over to Kanchan.
To Dr. Purnima.
Oh, sorry, Dr. Purnima.
Thank you so much, Professor Laurie. Well-conducted session, and thank you so much for very enlightening guest speakers. So the best thing about being a host is that you have to listen everything, very focused. So I actually, Dr. Chatterjee had a question, the elephant and the mouse, and Dr. Vardhan gave me the answer. Okay, so in my opinion, as a doctor, I think the mouse is the Ayurvedic system, and elephant is the modern medicine. And soon they would have to talk to each other or listen to each other. Second question, so this was the answer of your question. Now I have a question that's yet to be answered by the computer scientists. And I heard that data, artificial intelligence, and it's going to replace the intuitiveness of human being or physicians or nurses. So I guess, is it time to call artificial intelligence as actual intelligence?
No, we're long away from that. What AI will do is give us better analytic tools. It's like, tax accountants. When we started having tax software, people feared that the job of tax accountants would go away. No, Excel spreadsheets and tax software simply make the human beings more effective at what they do. So the doctors that understand these technologies will become better doctors. Their role will change also. Just like for education, we're talking about knowledge transfer versus character development. It's the same thing with data and medicine, with Ayurveda. If you can get AI to do a lot of the analytics for you and provide you better data, it's your intuition at the end of the day that's the most valuable. No AI is ever going to be able to do that. This thing about AI getting human capabilities, it's complete rubbish. I mean, these people assume that there's some magic there that when the systems start learning themselves, we're nowhere near that. Right now, what we have with AI is pattern recognition, very good pattern recognition. That's all it is. It's being overhyped, and we're nowhere near what's called artificial general intelligence. So the human being still needs to be able to interpret the data, and those who use the data effectively are the ones who are going to be the most valuable human beings. Just like in education, those teachers that can use technology effectively will be the best teachers because they know what their role is. They're the guru.
Right.
Well, I just add one line to Vivek's thing. I believe that artificial intelligence will always be a derivative of natural intelligence, because we created the artificial intelligence. How can the derivative be greater than the original? However, there is something called natural stupidity of humans, which will always be inferior to artificial intelligence. And if that is the yardstick for comparison, then of course AI is a great tool. But otherwise, I think it is natural intelligence that prevails, as far as I can intuit. I'm not sure as much as Vivek would be, but I'm certain that there is something to natural intelligence that we haven't discovered yet.
So actually, I put that question was more of a not to be taken very seriously, and I knew the answer that it's debatable, and since artificial, it will always remain artificial. So that was my view on it, and I guess I knew that when I will choose who is elephant and who is the mouse, there will be reactions. As Dr. Chatterjee says, that is up to your imagination. I'm already getting the comments. And I was being very modest because I believe I'm a modern medicine person and I know what are the shortcomings of that. And I believe in Ayurveda and I practice Ayurveda on me. And it has helped me a lot. So I think the answer can be either way. So Dr. Balram Singh ji, I totally agree with you, but I just want you to be a little more modest here. And then to end this session, because we are just on time, I guess we still have to define what is education. So that's what I got for it. And by these comments, I hand it over to Kanchan. It has been totally fascinating and very, very stimulating. I thank both the speakers and our chair. And namaste.
Namaste.
Thank you, Dr. Purnima, for hosting this session, and Dr. Dandori for being the chair for this session, as well as Professor Chatterjee and Professor Wadhwa. Thank you so much. I have learned so much today also, as usual I do when I have a chance to talk to you. And so we are at the fag end of our two-day conference. Our final session is starting now, the concluding session. And if you have time, I know, Professor Chatterjee, you had another engagement, I know, at night, but you are welcome to stay. Otherwise, we will go to the next segment. Same to Professor Wadhwa. Our concluding session is we're going to have two eminent speakers and experts, along with Dr. Balram Singh, the chairman of our Boston Center. He will give a concluding remark at the very end. So first, I believe we're going to invite Dr. Hans Reimer, all the way from Switzerland, joining us today. And welcome, Dr. Reimer. And it's a great pleasure to have you today with us. We met recently, thanks to our consulate introducing you. Just a brief introduction about Dr. Hans Reimer. He has studied yoga and Ayurveda and philosophy in India. In 1991, he started the first Ayurveda hospital outside of India at Walsenhausen, Switzerland. I hope I pronounced it right. He is the president of the Swiss Association of Ayurveda Physicians and Therapists. It's called VSAMT, as well as the Association of Ayurveda Professionals worldwide, and it is in Switzerland. And just to mention something, that I attended an Ayurveda-related conference in India, and I asked how many medical doctors were there, like modern medicine doctors, and the answer was, we don't know, maybe 1 or 2 out of 300 people. And I think same thing in America you will find, but at Boston Center of Excellence, all the events we have organizing for last few years, we have at least 25% modern medicine practitioners, nurses, doctors in our events. And in Europe, it's so different, and we are so much inspired by the work of Dr. Reimer and others, that in Europe, he is a medical doctor. Yes, he is also a Ayurvedic Vaidya. And it is amazing, inspiring for all of us. So with that, Dr. Reimer, please.
Thank you so much. So I'd like to share my presentation with you. Can you see it?
now. So yep, it's good. Great. Thank you.
Very well. So the history is about 15 years ago, 20 years ago, we started our association, and we started to make propaganda to popularize Ayurveda amongst health professionals, but also amongst the general populace. And we were quite successful in Switzerland. We created so much awareness after 10 years of hard work, together with the other systems of alternative medicine, that there was a popular vote to anchor the support of alternative medicine in the Swiss constitution. So in 2009, there was a vote on it. Interestingly, the politicians in the parliament were all against it. Although a survey showed that 65 to 70% of persons in Switzerland were using alternative systems of medicine in their home. And accordingly, the population voted with almost 70% agreed to it, which was a referendum with very high output. So after that, they had to put a law in place to further education in alternative system of medicine. And we got together with other ones of homeopathy and Chinese traditional medicine and European traditional medicine. And in Ayurveda, we worked out the identification of method, what is particular to Ayurveda, and the occupational profile and the syllabus we had to complete in all the 3 official languages in Switzerland, namely German, French, and Italian. So it was an immense task which took 9 years to complete, to get all of this together. And finally, with the help of other associations of alternative system, we were able to make a tronc commun, because the parliament said they don't want to make a separate law for Ayurveda doctors, and they don't want another law for the Chinese doctors or for the homeopaths or for traditional European practitioners, but it should be one tronc commun. That means 3 years of education in general medicine, in modern medicine, anatomy, physiology, pathology, and also how to run your practice. So all that is common to all the 4 systems that we can see here. And on top of it, then there is a speciality in these 4 systems: Ayurveda, TCM, TEN, and homeopathy. These Ayurveda physicians are allowed to diagnose and treat patients, as well as prescribe and produce traditional medicine. So this is a great asset in the sense that I can practice in Switzerland the same way as I was practicing in Bangalore in India when I was living there for 25 years. And these special alternative physicians, they contribute to health and medical care, because we had also this distinction this afternoon and also yesterday by Dr. Bhushan Vardhan, that Ayurveda can focus on the health management, but the Ayurveda physicians with a diploma in Switzerland, they can also do medical care, and in that way less very cost effective and with less negative effects than modern medicine. So to say that modern medicine is very handy in the acute part of medicine, but it is helpless and can be counterproductive in the chronic diseases. And hence we have in Ayurveda a lot of persons who were not dissatisfied or had bad side reactions. with modern treatments who come to Ayurveda. So that is mainly the profession I treat. I have my own pharmacy. I produce my own medicine. I prescribe my own medicine. I had to go through a registration process, but I can do all this work officially, and also it will be reimbursed by the health insurances. Then, uniquely in Ayurveda, we created a second profession, and that is the profession of the Ayurveda therapist. The therapist is mainly engaged in the management of the healthcare, giving dietary advice, giving lifestyle advice, and giving also protective treatments or immunizing treatment, or giving rasayanas, rejuvenation treatments. So in a very, very cost-effective way, because after all, we have to look at the cost factor very closely. And since the therapist can do the primary health care in the most cost-effective way, they are a great support for the health system as a whole, for everybody. Also here we got together with other groups. We got together with a group of craniosacral therapy, with shiatsu, kinesiology, polarity, Feldenkrais, and very importantly, of course, with the yoga therapy, which is also established in Switzerland as a profession in the primary healthcare area. So I find it very important also in the light of the discussions today, who will bring this knowledge to the people. And this, therefore, unless we create in other countries, or especially in a large country like United States or Canada, we create such professions of alternative physicians and alternative therapists, we cannot saturate into the mainstream of society. So a lot of work has to be done by the societies also in America to make the way open for young generation of health professionals who will go the Ayurveda way. In this way, we are believing in Ayurveda to invest in health and not in disease. So this therapy, and with the therapy, I don't mean an academic career of Ayurveda as it can be done in a university in India, where you can have a master degree in Ayurveda. That is fine for research and for the hospitals there, for the medical part of it. But for the large part of investing in the health of the population at large, we need people who have a shorter education time span, who have to invest less money to get educated, and at the same time we have to make sure from the point of our associations that they are certified and are really good professionals. So education for Ayurveda professional has to be established worldwide. And how this can be done, we have shown in Switzerland, and now we are starting also in other European countries. And that is my advice today, to help people in other countries to get as quickly as possible a large community of Ayurveda therapists and Ayurveda physicians. And in that way, we can do the groundwork that society will have this knowledge that the speakers before me were so wonderfully talking about, namely the holistic system of Ayurveda, which encompasses the whole human being and the environment they live in. Thank you very much. that I was able to present our work we did, and I hope it will enthuse others in other countries to also start their hard work in order to establish Ayurveda education for therapists and physicians. Namaste.
Impact not just in your country and Europe, but also it will have an effect on us in the US and rest of the world. So thank you for sharing that. And our next speaker is none other than Miss Hilary Garibaldi, and she is the Executive Director of the National Ayurvedic Medical Association, called NAMA, N-A-M-A, and principal founder of Ayurvedic Health Education Services, LLC, which offers education and training programs in Ayurveda. And she can tell more about NAMA in her presentation. She's going to do that. But NAMA is the leading organization in North America who has taken the Ayurvedic knowledge to the grassroots level for many years now, and Hilary is the leader, I would say, in this whole movement. With that, please welcome Hilary Garibaldi. We don't see your video somehow, Hilary. If you please turn on your video. We saw you earlier, but I don't know what happened. Mahendra, can you please check? Oh, yeah, you were there, then something happened. We just saw you. Mahendra, are you checking? Okay. While we do that, let's see. Okay, so there's some internet issue, and actually Dhananjay ji, he is not able to join either. So Mahendra, can you please check if Dhananjay ji is there? Dhananjay Tiwari. So Mahendra, can you please resend the invite to Mr. Tiwari? Hilary, are you there? Something happened. So why don't I request Dr. Singh? Okay, Hilary is here. So great. No, again went away. Something has happened. That's bad. Okay. So while we wait for Hilary to get back, may I request Dr. Balram Singh to actually give his remarks, what experience we had, and then we can end with the final remarks at the very end. But if you please share your thoughts about the conference, how it went, it would be great.
Sure. So you're telling me have some tentative remarks.
Yes, please. Tentative remarks, and then you have final one after Hilary. Hopefully Hilary and Mr. Tiwari will join, and we'll see.
Well, I can try to speak in Hilary's voice, and
I see.
that would be one way to look at it. Yeah, but maybe you can call her, or somebody can call her and see.
Well, yeah, actually, you know what? I can do that, but you continue. I'll call her and put her on speaker.
Yeah, and maybe by phone. If not on this, he can join by phone.
Yeah.
So it has been such a wonderful event. I've been glued to the whole thing. Every presentation I've been glued to, and I've learned so much. We were initially a little bit concerned about what to talk about in COVID-19 period, because so many people are talking so many things. And it was such a great idea for the board of directors to decide that, we want to talk about post-COVID-19. And as the talks have shown, that many of you who have been in this business of thinking and doing and helping and serving have already thought about it. And so many new ideas came. And I think, I will be presenting a little bit when my turn comes, what I think might be happening also. But I think the fact that we are talking about health, but it is really health in a very broad way. We are not talking only about health of the human being, but also we are talking about the society. We are talking about the whole planet. And when we see that, I think there is a resurgence of connection between what we see, science and the society and the environment and the planet. And one of the most interesting thing that I observed is that a lot of information is coming out of India. A lot of you have connection to India. Those of us, including myself, who now live outside India. But you have connection and you find your own niche. We all find our own niche as to how to connect. And in that process, sometimes I believe we think that, we are not too many. But in reality, you don't need to be too many. Maybe that actually is a blessing in disguise. If there is nothing in this world that I have seen ever happened substantially revolutionary has been done by majority or somebody in power or somebody in the position. Most of the time it has been really a small group of people who have some very revolutionary ideas or maybe something out of the box thinking, and then they are the one who make change. But they make the change by their service, not by their authority. And I see that being displayed by all the presenters who are in this, and we are very, very lucky to get all the presenters that we requested. They agreed to it, and so that there is some coincidence in that, and there may be some message as well, is that we are able to we are able to connect all of us who are in the mode of serving. And I believe, and there was a discussion just before this session, that when you have knowledge, then you are supposed to be humble. And when the humility comes, service automatically comes. And in the name of service, Hillary just showed up. So I think I will shut up and let her talk.
Can you hear me?
Yes.
Okay.
Yes,
all right. Well, I can't see anybody, but anyway, I'm so honored to be here. Thank you for inviting me and for a moment or two to talk about our efforts in the United States. So many wonderful discussions today. Unfortunately, I was unable to make yesterday's talks, and I have so many notes and am inspired. I did have a PowerPoint, but I just want to share that, Ayurveda, has breached the walls of India, over the course of the last 30, 40 years, due to a calling, I believe, of the broader community in the world that's looking for this knowledge and a system that really speaks to speaks to us individually and is connected to nature and to the wholeness that I think people are feeling very separated from. And this was brought up in many of the talks today. And I see Ayurveda as that answer for sure. I'm so dedicated to it and its advancement and part of the scene here in the United States to bring it forward. And I am so appreciative of the work everyone has been doing, and it's inspiring to see what's happened in Switzerland. Switzerland is all kind of United States is a vast country. It doesn't happen or necessarily happen step by step, state by state. We also are back in 19 went what being a country that was open to many different systems of medicine and natural systems of medicine. They were practiced. There was an openness to medicine and homeopathic medicine and naturopathic medicine. And about 1910, a report was commissioned by the Carnegie Foundation to really look at medicine, and at that point, functionally, alternative medicines disappeared, natural medicines disappeared, and were replaced by what we now know as modern, Western medicine. So we're digging out of that hole, and there's been
It seems like we lost connection again.
Let me call her.
Connect on the phone.
Yeah, that's what I'm going to do. I'm going to call Hillary.
So I can continue while you're...
No, give a second.
Okay.
Hello?
Hillary, I think there's some network issue. You can speak. I'm putting on speaker on the phone.
Okay, great. So I'm not sure where we left off, but I was pointing out to the fact that the United States is very different than other parts of the world due to the demonization, if you will, back in the 1900s of natural medicine, and the glorification of Western medicine as the only medicine worth anything, to the point where it was against the law to practice many forms of natural medicine. A lot of this hasn't really changed enormously, although big strides are starting to happen. And, as yoga made its impact on the world and on the United States in the early 1900s, 1930s specifically, the doorway opened. But it really wasn't until the late 60s, 70s where we started to see brave souls from India come to begin to teach Ayurveda because they were called...
You can all hear us, right, Balramji?
Yes,
okay.
Yes.
Good.
Clearly.
Very good. And so we're forever grateful for the pioneers before us and the brave souls that decided that to bring this knowledge. And there was a thirst and hunger then, and even more of a thirst and hunger now within the American population for natural, holistic, personal-based medicine that Ayurveda really satisfies. We still are fighting battles state by state to become recognized, and this is the perennial work, actually, of the National Ayurvedic Medical Association in helping to establish Ayurveda in the United States. It's very complex. We have a lot of distractors. We have, a lot of battles to fight, unfortunately, in this regard, but there's a calling, and I think we really believe we're going to get there, soon. It just takes time, and it's a state-by-state effort in the United States. This doesn't happen from a national agenda. Healthcare is governed in each state, and so we work one by one through the process. Part of establishing a profession is what NAMA's been up to for the last 20 years, and there's a three-legged stool that must be, carefully constructed to get there. And the first leg was building a strong membership organization that brings the community together, all the various parts of the community together to speak with one voice, to show the glory and the value of Ayurveda and to support one another. And that was the onset of the National Ayurvedic Medical Association back in the year 2000. The next leg was to build defensible certification exams. And before we got there, standards had to be set. And standards in the United States are different than they're going to be in any other part of the world. So the idea of setting a global standard doesn't really work from country to country. Each country is to set its own standards based on its relationship to all the other systems of medicine that we have to live with and coordinate with. So NAMA took it on very carefully to build standards that will will honor the roots of Ayurveda and will also become more accepted as we enter into our own full profession. So that work was done, and from that, the basic competencies were developed to which the exams have been written. Certifying professionals is very important in your movement toward recognition, because there has to be some evaluation markers for any profession. And we needed to put that in place. So that piece has been a huge investment of NAMA's time and money over the last probably 8 years. And we're still working on our final exam for the Ayurvedic doctor category. We offer 3 categories: professionals here in the United States through our organization, the Ayurvedic Health Counselor, which is much what Dr. Reiner was talking about with the technicians or the support network of people that would work within the realm of diet and lifestyle. An Ayurvedic practitioner, which is another level up, and these are our professionals that work with very common disease and disorders, the chronic diseases. And the Ayurvedic doctor is the epitome that can work with specialized conditions and cases and have more advanced knowledge of aspects of Western medicine in order to be able to communicate very carefully between the disciplines that we have in the United States. So this is the second leg, and the third leg is to build an accreditation organization council that actually oversees these educational institutions that are critical to the growth and the foundation of Ayurveda. And it's so interesting the time that we're in and the discussions about online education and how difficult it is to negotiate a science like Ayurveda, which in my mind personally is a living science, and for me was handed down from teachers in front of me, sitting in front of them and bringing in that wisdom and energy that you can't get any other way than by sitting in front of your teacher. And that is the tradition, the Guru Shishya tradition of Ayurveda and the Vedic educational tradition. And I feel that needs to be solidified and maintained as much as possible, while also seeing the challenges that COVID has brought us and has forced our educational institutions to go online and to offer education in that format as well. So there's a place for both, but we have to build it carefully, and that inherent knowledge that you get only by sitting with a teacher, viewing them, feeling them, the presence, having the knowledge exude through their pores to the student. There's no replacing that. It is incredibly important for us to acknowledge the roots of our education, the roots of Ayurveda, and it is our goal at NAMA to honor those roots as best we can while adapting it to this environment. And that was mentioned very early on by Dr. Frawley and others, that this is this is being transplanted to another country, and we need to utilize the environment that we're in and understand it. And Ayurveda is about building awareness and connection and understanding and knowledge. And all of that has to happen upon self-reflection and self-knowledge and going within. So all of the beautiful talks before us just built, my conclusion as one of the last speakers, that there is a lot of work to do. There is an openness and a doorway into all of this in the United States right now. And the United States, can be a leader if we're able to really establish this. The world still looks to us in many ways, even though that may have diminished in the last, few years. But we, if we can pull this off successfully, if we can get Ayurveda recognized and utilized in this country, it's going to help advance it across the globe. And the bottom line is that we're here to serve and to bring this knowledge to as many people as we can to, help them, advance in their own lives, health and well-being. And that is ultimately our goal. So we have a ways to go, and I truly appreciate the Boston Center for Excellence for having these forums and for bringing such brilliant speakers together, and to feel that network of all of us around the globe working toward the same goals. It's very inspiring, and I want to thank you all for having this event and inviting Nama to be a part of it.
Well, thank you so much, Hillary, for the vision you have and the work you do. We all appreciate that. And the technology did not cooperate at this moment, but I think people could hear your message very clear and loud. So thank you for that. And let me go back to, okay, my video is on. So Hillary, thank you again.
Thank you.
Yeah, so we will continue to work with you and Nama, as Boston Center of Excellence is a partner of all your work. Thank you again. I'm hanging up and then handing over to Dr. Balram Singh back again to give his closing remarks, final closing remarks.
Can you keep me on the phone so I
am. Okay, I'm going to. Okay.
All right. So thank you again, Kanchan, and thank you all the speakers. I'm sure there will be a formal vote of thanks. But I did want to make some remarks, and I decided use my slides again and hope that works. All right. So it's working.
You make a slideshow, then it will be fine.
Yeah. So I just wanted to cover a few things that I was really impressed with, and maybe as my final thoughts.
Your screen is blank. Sorry, it's white.
Yeah, I know, because I didn't put it.
Okay, got it.
So there is this discussion about this, how we can go about all this, and there are so many issues. Of course, health related, human development related, economics of the world, and there are a lot of conflicts. Also, we talked about that. And there is a term that normally people in power or intellectuals use. They call world order. Henry Kissinger is the latest one who has written in 2014. And if you are interested, you can of course look at that. He's just talking about democratic idealism of the United States and how it has failed or succeeded. Before that, there was one from famous Noam Chomsky, who has also written about Western government and imperialist foreign policies and so on and so forth. And he has his own conclusions. But there is a world order. Everybody is talking about a new world order. Before that was a world order book written by Samuel Huntington, Clash of Civilizations, and which he talks more about religious groups as the civilization, and maybe some political groups also. So I think since this is in the norm, we should also think about Ayurveda and Yoga world order. And so I'll go through a little bit of the presentation and see whether that fits into this. So first of all, Ayurveda and Yoga World Order is really an individual based. We all have everything in us, all the herbs, all the thoughts, all the meditations. And there is a science. There is a science, that science of Ayurveda and science through Ayurveda, and Ayurveda as a way of science. So there's so much to do in science. And I think we need to work on that too if we want to have Ayurveda Yoga as a world order. There were some discussions about it. This Kessler, I think Kessler was the name, I forget the name, Christian Kessler, I believe, who talked about the connections, love, relationship, friends, attitude, and that will apply to any and everything. And then there was a discussion of economics, reverse innovation. I think that was a very interesting idea. Dr. Panagadia from Columbia, he talked about, which means things can be reversed. Maybe economics. I had some question and that question was not answered. This GDP growth-based economics, which of course he talked about, can that also be reversed? And that's the point. But that will be a different kind of world order. And then we have, I didn't have a chance to talk about, but since we are now talking about world order, the education is always going to be the key. And one of my publications recently came out in Ayurveda Journal of Health, where we are using Ayurveda as a pedagogy. Students love it. They get part of it. They become so much excited. You know, they made quilts to learn. You know, they knew their Vata, Pitta, Kapha, and then went around and, you know, all kind of things they learned in collaboration with Erin Kochenek, who is a school teacher there, and she was trained in one of the programs that I was involved. So there is an education part of it. And then something that was very interesting that David Frawley, Bamdevaji said, that how do we learn, what are we, in the world of COVID and virtual learning, what are we doing? Are we doing the right things? Well, it seems like when we are not doing anything, we're just watching. And when we are watching sports or movies, we are watching screens, and there are so much chemicals coming in our own body at that time, but the body is not doing anything. And so there is a disbalance, and that may be causing problem not only in disease and other thing, but also in learning. And then the interesting thing that was Dr. Chatterjee, Devashish Chatterjee talked about, wonderful lecture. He gave very simple one. And it is very important to know that he said that Aristotle, sorry for the spelling mistake, Aristotle, Buddha, and Krishna will probably deal better. The question is why and how would they will deal with it better. I hope that we will have some insight into it. If we really want to create a world order, I think we need to think about that. Okay. So, oops, I didn't want to let this up. Of course, we were very honored to have the Minister of Ayush inaugurate the conference. I didn't have a screenshot of his, so I couldn't put it up here. But the health minister, very knowledgeable person, and doctor himself is a surgeon actually, and met with him, a deep thinker. And he talked about two things about India. Among other things, he gave all kind of reports about how India is doing in COVID time. But he did talk about something that we are interested in. Is talked about the Vasudhaiva Kutumbakam, or the entire planet is a family. But then also he talked about nationalism. He talked about India is about nationalism. I think there seems to be a contradiction. I think we need to educate ourselves about that. Nationalism and Vasudhaiva Kutumbakam do not go together. We have to think about something else. And that is, India must change its instance to. But how would that be happening? Through duty in service of humanity. It's not like you are forced as a slave, which has happened in the past in the history, but with the service. And I think many of the people who presented here, I think I see them the living example of that. Then there were discussion about story, how stories are so important to learn. And this story of plant cell. The microbiome story, the plant cell story that was told by Jerry Solfvin in a very, he's always interested in the mystical things, and he talked very vividly about that, how we can follow the plant cell growth into tissue and plant, and then we learn from that. And Professor Badhua was talking about there's so much data already there. We don't need to do research. There's a story about microbiome. Maybe we can use that. Is that an appropriate story? Do we learn it appropriately? That's, of course, a question. And then there is a Professor Chatterjee came back to say the guru is a process. You know, I just heard about guru that Hillary was talking about. And how do we go about education? Upanishadic pedagogy of education, which is the guru and Sishya sitting together, but being asked. The guru is being asked question by learned students. You know, students have to learn something to ask questions rather than what we do today. And so ultimately the answer to a question that Professor Chatterjee had asked about the mouse and elephant story, a mouse who wanted to get a ride on the elephant. And mouse thought that mouse is doing so many things, but actually elephant was not even listening. So the mouse as a modern medicine and elephant as the Ayurveda, which is that there are natural things that happen. We may be using science to a certain degree somewhere. It may be making some minor things, at least to people who do modern science and modern medicine. But it may actually, Ayurveda may be the bigger picture, because the Ayurveda is talks about Vesti and Samasti, the whole system and the whole surrounding. So I see that is already happening. I see when Dr. Reiner talks about the effort that he has made from his journey from Bangalore to Switzerland, and how he has been able to convince the entire nation to follow the Ayurveda. I hope that some of the things, the educational and pedagogical things also continue. Slowly that will happen. Is a great asset, and people through Nama with whom I have been able to work, including Hillary, Garibaldi, is that they are very committed to education. Education is the key for everything. And so I think that is the way to create a world order that we want. I'm going to make a point that there was some reference to this Ramayana. How do we do that individually to help everybody else and the whole entire planet? Is that one has to keep one's word, and then it has to be in the welfare of others, and then listen to those who do not have any conflict of interest and tell us what to do. So this is very important aspect. This is an element of Ram Raj, as it's in Mahatma Gandhi tried to articulate. And in that process, there is science involved, and in science that we have two ways of learning: inductive and inductive and deductive way of learning. And there are a lot of texts, and the reason only I'm presenting this, I presented this in my presentation this morning, but I'm presenting again for the larger group to see that there is so much text, there is so much process that has gone, and way of learning, nothing to be discarded. I think everything can be used as long as we are connected with the nature, and then we should be able to make the difference. And one of this is my last slide, to say that yesterday there was a great celebration in India happens, and it's very important how to scientify everything. You know, we are talking about lifestyle. Ayurveda and yoga is a lifestyle, and that can happen only if we are able to educate the public, and the public becomes the practitioner, not that it becomes a business. And so yesterday was this Chhat Puja in Bihar, which has so many scientific aspects of it. I wouldn't have time to go into, but since it happened yesterday, it talks about how to be knowledgeable, how to use sun, how to use nature, how to eat what you eat, how to do the fasting what you do, and how women are very important to protect the rest of us. All this social as well as medical and health and Ayurveda and the whole connection with the nature is really practiced in all this. So science through rituals, daily, fortnightly, monthly, yearly observations. I think this might be the way to spread this without having a lot of resources and expecting a lot of resources. I think with those words, I would like to say it was a great event. Thank you very much, Kanchan, for taking so much trouble to organize this. And of course, all the board members and all the people who participated in last 2 days who have made it happen. Thank you very much.
Okay.
So I'm done.
Okay, Balramji, thank you so much. This was very unique in our programs that you have actually taken the trouble and pain to actually take screenshots and creating a actually presentation on the presentations. Thank you so much. This was a very good thing happened today for many of us to emulate in future. So it has been my privilege to work with all of you for last few weeks to organize this event. So our colleague Pramit was to do this part of vote of thanks, but he has to take a flight from Chennai. So he gave it back to me. So I will try my best. I didn't take any notes, so I'm just very thankful to everyone. But I will start with one unique person whose platform we are using actually called Unitalk. And this is the few young entrepreneurs. They have started this platform only recently, and it was a great test that how the system works. There are some there's some room for improvement. We are giving all the feedback. But Mahendra, can you please come in on the screen for a moment?
Sure. Thank you for having me join here. I was not expecting to do that.
So Mahendra Penumasta, originally he's from Hyderabad, and now he's in Chicago, but their company started in Boston, and we are using their platform. And last few days, he has been 24/7 supporting this with his team in Bangalore. So thank you so much for this, or helping us doing this event, and hopefully in future we'll use it again. So you want to say any? Okay, go ahead. Okay, so let's start with our board, the Boston Center of Excellence board, and all the board members, and Dr. Balram Singh has been guiding us. Dr. Purnima is there from the board. I don't know, Darshan is there. So thanks to all for supporting this event. More importantly, people from, I think we saw 18 countries participated in our event. And actually it's hard to tell because now Facebook Live and YouTube Live that did not tell us all the numbers immediately. But I think Facebook Live was at any given time, there are several hundred people joined from all over the world. And thank you all the participants, and for your it is encouraging that so many people are interested in these subjects, and that's going to take us to the next level of our activities. I just see Dr. Dinesh and Dr. Patel is our great advisor for a long time, and thank you so much for your guidance. He's our co-chair of our advisory board, along with Dr. H.R. Nagindra. He had a conflict of event today and yesterday, so he could not join us, unfortunately. All the panelists, oh my God, everybody is so unique. I've been here, I'm getting text messages that everyone brings a new perspective, a new angle, new viewpoint to this forum. I actually personally, I have not attended any event that enriched me so much. And I'm personally grateful to all the great speakers, all the way from Switzerland, from Berlin, from Argentina, to India, and of course, US and Canada. So excellently presented. And one thing I have learned that COVID era can improve our effectiveness using this kind of tool is that I personally was also surprised that most of the sessions started on time, ended on time, except of this one, which because of me, I'm talking too long. But almost every session started. So our physical events typically run over, and then a lot of back and forth. Where is the speaker? And then you have to show the the minutes left and all this. Without doing any of those, I think our event went almost like harmoniously and excellent way. And the people who are in the back, those who are actually helping in promoting this event, I don't have all their names, from India and from US. Thank you to all. And finally, our consulate in New York and our Consul General, Honorable Mr. Randhir Jaiswal. Without their support, this event could not have been possible. And we thank the consulate and Consul General personally, and our Deputy Consul General Satyagna Sinha for supporting this event. And they have promised going forward, we're going to do more events like this and bigger events like this. And last thing, I think Balramji already proposed that we'll do another event similar to this in a few months' time, maybe in January or February again, and we'll have more experts like you all will join us. And in the meantime, we're going to have we're going to continue our work as Boston Center of Excellence. And any of you have any suggestion that how we can improve or advance this knowledge of yoga and Ayurveda and integrative medicine, please do let us know. We appreciate your feedback, and also about this event if you have any feedback. And finally, if any one of you would like to join us with the Boston Center of Excellence, please do write to us. We will welcome you to work with us, research and promotion of this great work we do. And also, if any one of you would like to support our activities, our initiatives financially, you are very much welcome, and we'll work with you. With that, again, thank you all, and namaste, and have a great time, and stay safe, stay well during this COVID era, and we'll be meeting soon again. Namaste.
Okay.